Here.
Chairperson Julia Botel,
Here.
Chair Pro Tem Douglas Lawson,
Here.
Councilperson Trodrick McCoy,
Here.
Councilperson Kashamba Miller Anderson, Councilperson Shirley Lanier, City Manager Jonathan Evans,
Present.
City Clerk Claudine Anthony is present. City Attorney Don Nguyen.
Here.
Thank you, Madam.
Thank you. We'll have a moment of silence followed by, led by Mayor Felder, followed by the Pledge of Allegiance.
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Mr. Evans?
Madam Chair and members
before we proceed, excuse me.
go ahead.
Sorry.
Before we proceed, let the record reflect that Councilperson Lanier is present.
Thank you. And Councilperson Kashamba Miller Anderson is present. Thank you.
Thank you, Madam Chair.
Mr. Evans.
Madam Chair and members of the City Council, obviously, we have begun the budget process, and one of the large components that is routinely discussed at this part of the budget process is the health insurance renewals. And so city staff has been working diligently with our partners at the Guerin Group to get us to a point where we think we have we will be offering a good benefits plan to our employees and reducing the overall cost. You'll hear in the presentations from representatives from the Guerin Group the challenges that our plan and our work population has with regards to claims to premium ratio. A lot of the challenges we have are associated with 13 high dollar claims that traditionally we only carry about 4. And the other side of it is more modifiable health behaviors. We have to get healthier as a workforce. We have to really do things to promote wellness and eating right, and things that we can do to not utilize or overutilize the plan. And so at this time, I'm going to turn the presentation over to Christian Bergstorm from the Guerin Group to make his presentation, and then he can also introduce representatives from his team. We have Mr. Stephen Good, who's our benefits administrator, to answer any questions as it relates to how the benefit system would work for our employees if the proposed changes are accepted. And I'm going to turn the presentation over to Christian.
All right, thank you, Mr. Evans. Good evening, Mayor, council members. I am joined also today on this call with Kurt Gehring, President and CEO of the Guerin Group, as well as Shauna Whittingham, Employee Benefits Consultant. This evening, we wanted to discuss with you the renewal for this upcoming year. Trying to get my screen to flip. It says I have control, Mr. Evans, but it's not flipping.
All right.
So we're going to talk about the medical claims experience, what has transpired since last year, and then obviously the considerations for the upcoming fiscal year, as well as the renewal with Aetna, and then also some plan design tweaks that we're considering. Also on the call, I believe, are some representatives from Aetna. So if you have any specific questions regarding what we've presented today, they can answer any of those questions for you. So if we can go to the next slide. All right, so your medical claims experience. We have historically here 3 years, and plus the last 12 months of claims data that's most recently available. We have the premium paid, and then the claims that have been paid, and then we have your loss ratio. So you'll see that the loss ratio has been consistently going up, 88% in 16-17, 97% 17-18, and then the last year, you ended the 19 fiscal year with a 108% loss ratio, meaning your claims exceeded the premium paid by over 8%. And then historically, now looking at the 12 months that are the most recent, you are still running at a 108% loss ratio. When we break it down to your claims per employee per year, you'll see that consistently over the last 3 periods, the claims increase has exceeded the premium increase. So in 17 and 18, you had a 3% premium increase. However, the claims increased 11%. Then for the 18-19 plan year, there was a 4.99% premium increase. However, claims increased 15.6%. And then now in this last 12-month period, and the claims have slowed down slightly. 8.6% is the increase in the last 12 months with a premium increase of 6.7%.
Excuse me, I just want to say, if someone has their mic on and not speaking, could you please mute yourself? We're hearing some noise in the background. Thank you.
Madam Chair, there's a caller, NR. I don't know if that's the person or not. It doesn't look like they're muted. They're not on camera though. Somebody NR.
Okay, thank you. Please mute yourself, NR.
And then we'll go over some utilization data here to show where the claims are being impacted by for the next screen. So what has transpired in this last 12 months is we've had a significant shift really from where we were last year in terms of the cost trends. So what is driving trend now is medical pharmacy. And so that is going to be those specialty medications that are filled through the medical plan, not at a retail pharmacy. So these are going to be some injectables. These are infusions that you would be receiving for a doctor for primarily cancer treatment, different types of psoriasis, rheumatoid arthritis. So these are going to be filled through the doctor's office for severe conditions. So the cost has substantially increased over 150%. Your inpatient spend has increased 26%, followed by your specialist office visits 5%. And then everything else is relatively flat or a reduction. So again, a majority of this cost is high dollar claims through medical pharmacy and inpatient stays. And the next screen. And right here, this points to us the top conditions and why that medical pharmacy is so high. Also, with the advent of some of these specialty cancer medications that are out there, they're being used to treat those that are insured under your health plan. So we had a 1,780% increase in the amount of cancers that were diagnosed and are now being treated under the plan. We had a 388% increase in nervous system claims, followed by infectious diseases by parasitic means, not necessarily viral, so 337%. We did have an uptick in premature births, so 147% increase there, and followed by 58% increase in respiratory diseases such as asthma. And then pretty much cutting down, it dwindles down to musculoskeletal disorders, and then followed by ear, nose, and throat. What I find very encouraging is the reduction of circulatory and kidney disease claims within this population. So this is good news here on this front. Next slide, please. So, and we looking at the utilization patterns and cost sharing, if we look at the left pie chart there, the blue is what the employer plan paid portion is. So in the prior year, the plan paid 92% of all costs. So the rest is made up of deductibles, copays, and coinsurance. So for this past 12-month period, keeping in mind that you introduced the high deductible health plan for October 1st, we now are starting to see a cost shift. So now the plan is down to 89%. And we see there that there has been an increase in the amount of deductibles and coinsurance that is being paid. So more cost share is being passed along to the employees through that high deductible health plan that was introduced October 1st of 2019. Then we also back to the previous slide. We like to look at what is paid per member with or without a catastrophic claim. And a catastrophic claim is any claim that's over $50,000. So if we look at all claimants, the actual cost is around for inpatient stay is around $2,197. That is for all claimants, but then when we net out your catastrophic, $481. So we can tell just by looking at this chart that the drivers are the catastrophic claimants, not the day-to-day users within the health plan. All right, thank you. Then taking into account your pharmacy utilization trends, there was a 46% increase in the pharmacy amount paid per member per year. So that increased from $1,479 to $2,154. And then the average copay and paid per claim did increase 52% from $142 to $216 per claim. Then you'll see the cost differentials there on the right-hand side of the screen between generic, single source brand, and multi-source brand, and the major discrepancies when you have a single source in terms of there's no competition. They can charge pretty much whatever they feel is in their best interest as a pharmaceutical manufacturer. So for this year, although you had a 32% increase in the cost of your generic medications, that's just $58 per script, while the single source brand went up $1,478 or 58%, and then your single source medications went up 147%. All right, so when we began early in the spring and we were looking at your claims experience and reviewing the large claims data, we would be expecting that an initial offer similar to last year with Aetna would be in the plus 30% range. If you wanted to be extremely aggressive, we would estimate that an expected increase could be at around a 25%. However, initially, Aetna came extremely aggressive to the table, knowing that the city could not bear an increase in the 25 or 30% range, nor could the employees absorb that either. So Aetna did come to the table with a initial negotiated released offer of 19% with no plan changes. So that is approximately a $1.13 million increase to the city's budget. Then we started to begin talking about ways to change the plan design, change co-pays, deductibles, co-insurance, different things to pass along costs, maybe changing the prescription drug formulary. And then Aetna came up with a unique option just to change the claims platform. So currently you are on what is known as insurance paper, and this would move the claims platform to what Aetna has as an EPO. And basically, it's just the paper that the contract is written on. So instead of it being insurance paper, it goes to EPO paper. And that reduces the increase from 19% to 15.9%. And all deductibles and co-payments remain the same. So there would be no change to what the employees pay when they use the plan. The only thing that would occur would be to eliminate out-of-network benefits. And a majority of employees are in a plan that doesn't have that already. So this would only impact the point of service plan and the high deductible plan. 98.6% of all admissions are in network, and 99.3% of all physician visits are in network. So we felt that this was a viable option to really consider changing the claims platform in order to save 3% just right there without changing the benefits. And then we'll move on to the next slide. And so what we would like to consider for this upcoming fiscal year is maintaining the partnership with Aetna, transition to the EPO claims platform, still utilizing a triple plan option. So you would maintain the high deductible health plan, the buy-up HMO, and maintain the existing point of service plan. In order to achieve savings for the city's budget, we do need to consider increasing the deductibles and out-of-pocket maximums of the high deductible plan and the buy-up HMO plan. So with these changes that I'm about to present, the increase reduces from 15.9 to 8.99%. So instead of a 900,000 plus increase, we're now looking at about a $534,000 increase to the city. For the high deductible plan, we're looking for the deductible of increasing the deductible from $1,500 to $2,000. The deductible for a family from $3,000 to $4,000. The out-of-pocket maximum for a single from $3,000 to $3,500, and the out-of-pocket maximum for a family from $6,000 to $7,000. So collectively, for those enrolled in the high deductible plan, somebody that has single coverage would have $500 of additional expenses after their HRA fund. And then a family enrolled in that plan would see an additional $1,000 in expenses. And then for the buy-up plan, the only changes being considered are not changing the co-payments, not changing the prescription drug benefit, just changing the deductible, which is applicable only to hospitalizations, from single from $500 to $750, and the family from $1,000 to $1,500. And then the out-of-pocket maximum, increasing that from $1,500 to $3,000, and the family from $3,000 to $6,000, which puts it in line with the high deductible plan, so that not one plan can be adversely selected against. So we feel that this is a nice cushion to help balance your claims cost, and particularly for those that have catastrophic claims, we can start balancing this out. So the fiscal impact, again, with this consideration for the upcoming year is around a $534,000 increase, or approximately 8.99%. This cost is approximately $85 per employee per month in additional expense. And as we had discussed last year, based upon your collective bargaining agreements, you do have the option to charge employees $20 since the renewal, an additional $20 since the renewal is greater than 5%. However, that's not being presented here at that dollar amount of $534,000. Here is the difference in employee cost share.
Hello, Christian, can you go back one slide? I want to make sure I understood. Board has the option to charge employees $20. Is that in addition to the $85 per month?
That would reduce the $85 to $65.
Okay. Okay, thank you.
And that would be borne by the employees. So that additional $20 is not in this recommendation from the city at this time. The employee-only rate for those employees in the high deductible plan would still have a no-cost plan to them. So the plan would be paid 100% by the city. And then the difference in the cost of that plan is for anybody that has dependents or that wants to buy up. So they pay 100% of the cost share of having dependents or buying up. Also, we feel that with this rate increase, those employees that are currently buying up and seeing that their increases could range from $414, and then families would have an increase at the bottom right of approximately $1,248 in their payroll deductions, that they would highly consider moving to the high deductible health plan in order to achieve savings in their payroll deductions. And they would probably then have lower out-of-pocket costs overall then by moving to the high deductible. So we're prepared to engage employees virtually through educational means to walk them through their own individual circumstances to see which plan would be the best option for them. So again, the plan design would be the exact same provider network that is used today. Aetna is going to still continue to fund $500 and $1,000 into a health reimbursement account for those employees enrolled in that plan to offset their deductibles. So that means that employees do have first dollar coverage in their HRA amount. So the first 500 is covered for a single, the first 1,000 is covered for a family. If they don't use those funds, they roll over year to year and can be used towards their annual pocket maximum. And we feel that the contribution strategy is going to encourage enrollment to shift from the copay plan to the HRA. And those employees that do so can also use flexible spending accounts to offset additional healthcare expenditures. Your ancillary renewals, so your dental, your vision, and your life and disability insurance are in rate guarantees. So there are no changes to the premiums for those products. And then I'm excited to announce that we did implement your electronic benefits administration system called BenTech. And I'm going to introduce Shauna Whittingham from the Garing Group, who is going to be reviewing some of the key features and some statistics with our rollout.
Before you do that, can we ask some questions of some of these items that's just been proffered to us?
Go ahead, Mr. McCoy.
Christian, so prior to the proposed changes, the increase was 19%. Is that correct?
Yes.
Okay. And after those proposed changes, we're looking at that going down to just a 14%, or is it 13%?
It's 15.9.
And what was the actual aggregate savings in the two?
All right, so the 19% is a $1.13 million increase. And the 15.9 is a $943,000 increase.
Do you have the numbers for the employee increase under both, or under both plans?
So their cost would increase either 15.9 or 19%. So their payroll deductions would increase by whichever option you wanted to.
Sir, I'm sorry, but I'm thinking the 1.3 million is the overall organization's cost. I'm speaking of the actual employee premium cost that's going to be deducted per payroll. Is that the same? Is that what I'm hearing you say?
No, their premium amount would increase by the exact same amount. It would increase 19.9%, or it would increase 19%.
Under the current plan, and then 15% under the new proposed plan.
If you didn't make the plan changes, yes.
Okay, that's all I have for now.
All right, thank you.
Good evening, everyone. Can you hear me okay?
Yes.
Okay, thank you. My name is Shauna Whittingham. I am your Gearing Group account manager. And as Christian mentioned, BenTech is live. So BenTech is your new online enrollment system. By implementing BenTech, the city now has an audit capabilities to bump and compare information from your payroll system to ensure accuracy of payments to your various employee benefits carriers. So our team worked hand in hand quite diligently with Steve Good, Pierre Smith, Willem Marcello, Eureka Young, and in some instances, even directly with Tyler Muniz, as well as your various carriers. So we've created a process to ensure that the systems match the employee's enrollment choice coupled with the city's rules and guidelines, for example, eligibility rules, which then equals payments to your various carriers. So if these items don't match, then we would sound the alarm, so to speak. So this process helps to ensure that there's no overpayment, there's no underpayment, and any myriad of things that could possibly go wrong. So on the other side, the user end of BenTech, we wanted to encourage your employees to log on, get familiar by setting up their accounts and updating beneficiary information, because we all know who our favorite person was last year might not be the same person this year. And so we offered an incentive for the first 100 employees to at least set up their accounts. So actually next week, the Gearing Group will be mailing out hand sanitizers to the homes of the first 100 city employees who completed this task. So this is one way to encourage getting familiar with the system, which is very user-friendly if you haven't explored it yourself, before open enrollment, which will tentatively begin the week of August 24th. As of yesterday, August 10th, my head's in May, we had 185 employees set up their accounts, and we had 72 employees update their beneficiary information. So regarding open enrollment, this year, we've all had to move to mostly a virtual environment. So as Christian mentioned, our team worked very diligently with your human resources team in preparation of serving your employees. So currently we intend to have 2, possibly 3 meetings per day if approved by the commission, from Monday, August 24th through Friday, August 28th, if these changes are approved. So our goal is to focus mainly on the medical plans as well as Bentech, because these are really the only two changes, and we feel it's important to educate city employees on what's new and what's different. All your other plans and rates stay the same. So each meeting will be held virtually, so employees may access from any device, such as a desktop computer, a laptop, tablet, my personal favorite, the mobile phone. Your public works building, the training conference room has been reserved with computers to also, for those employees who want to gather, of course, they'll stay 6 feet apart. They can attend sessions in person if that's what they prefer. So during last year, per the city manager's recommendation, we had a family day, a day where employees could invite their spouse to attend sessions and ask questions, as oftentimes it might be the spouse who's comparing and analyzing their family benefits. So with this year's virtual open enrollment session, spouses may log on to any of the sessions and attend from the convenience and safety of their home, their office, even the beach. I doubt that we'll have 100% their attention if they're on the beach, but you get my point. We're making it extremely convenient. And lastly, we're also offering admin assist. So this is for employees who, for whatever reason, have trouble logging into Bentech, whether they don't have a smartphone or they don't have access to a computer. What will happen is they will call a member, they'll connect with a member of our team, and we'll handle their enrollment via phone. So we'll send the employee as well as your human resources department confirmation of said enrollment.
Thank you, Shauna. So in conclusion, we want to, again, offer a competitive benefits package that allows for transparency and cost. So with the high deductible health plan, and also to help us improve consumerism with the healthcare expenditures. The recommendation is transitioning to Aetna's EPO claims platform. So new ID cards will be issued, but the provider networks will remain the same. So there will be no disruption there with the current providers that employees are seeing, or if they are in the middle of care. So they will not have to have transition of care. If they're undergoing a cancer treatment or any other type of treatment that's ongoing. Through Bentech, your billing processes are going to become more accurate and transparent. Employees and dependents will enroll online versus in person. So that helps reduce our risk of contracting COVID-19. And this saves, the recommended changes saves around $595,000 from the renewal at 19% with just those deductible and out-of-pocket changes. And also, I'd be remiss to say that I do have Kathy Aguirre. She is with Aetna, along with Renthia Jackson and Gabby Dimitrakis. So if anybody has specific questions to the claims platform and where we are today in terms of the overall renewal, Aetna is here on the call as well to answer any questions that you may have of them.
Thank you. Mr. McCoy, you have a question?
Yes, of Christian. So I'm trying to follow along with the spreadsheet, and the increases that you're speaking of only exist for employees that opt into the buy-up plan or employees who remain in the existing plan and have either one additional person on that plan or a family. That doesn't encompass just someone that just takes the regular standard plan paid for by the city, correct?
That is correct.
Okay, the Benetech system that you spoke of, seems like I heard this before. When did that go into place?
So Bentech went live on June 9th is when it went live, but we announced to your employees in July, on July 15th. Correct me if I'm wrong, Steve.
Perhaps, let me clarify the question. The budget meetings last year, we were told that the Benetech system was a part of our 19 and 20 budget that we're going to be rolling out. I don't know if this is an added benefit that's provided by the Gehring Group, but wasn't this a part of the discussion last year at budget time doing the same scenario? But obviously we were in chambers, but.
Yes, so we were rolling that out to the city as an included benefit of utilizing Gehring Group services. And so we took the beginning of the fiscal year and the first quarter of the year to implement the system with your various carriers. And then beginning in the second quarter, that is when we started with file transfers between your payroll system and Bentech, and an audit was performed. So they're right now auditing files on a weekly basis to make sure that the enrollment data is accurate.
Okay, but if I'm understanding correctly, you're saying that that didn't go into place until what, February or March of 2020? Is that correct?
That is correct, yes.
Right, but why wouldn't it have went in prior to that? Like right after we solidified with you guys and we did open enrollment back in what, September of 2019?
Yeah, there were some delays in working with.
Christian, I'm curious to know.
I'll let Mr. Gehring speak to that.
Mayor and Council, how are you doing tonight? It's Kurt Gehring from the Gehring Group. What happened initially in the first quarter, if you remember, there was a breach of your system. So there was a little bit of a delay of getting started right after October of that year. And then in January, there was Tyler Muniz working with Tyler Muniz getting the files straightened out. Took a little bit of time, but it still takes about 3 months to do a complete rollout. And our biggest goal was to make sure we rolled out the system prior to open enrollment, so that right now we're actually transferring files and using the system kind of an opening before we go through, open enrollment. Because what we want to do with open enrollment is try to get all your employees' beneficiary information into the system and do a full enrollment. So even if the system had rolled out earlier, it still wouldn't have been, we really are targeting is that open enrollment for the next year, and more importantly, making sure all your files are correct. And when we audited, that audit also was something that we could retroactively look at. So we feel very confident that, everything in payroll that comes out of payroll is going to match up with eligibility and premium payments at this point moving forward.
Follow up.
Go ahead.
And that was my next question. When you guys did do that audit, so after you did get it installed from fiscal year going forward, which was October 1, what did that look like? I mean, was there any that fell through the crack because we didn't have the Benetech system at that point?
Stephen, do you want to respond to that? I know that we had some differences, but a lot of that also had to do with the file formats and the way the file formats were coming over. So what would happen is a file format would come over, we would do that audit and then make sure it was more of a file issue than it was a discrepancy as far as paying for folks that we shouldn't pay for. But the system audits all the way down to social security numbers, their zip codes and addresses and stuff like that, which really makes everything efficient. But Stephen, I don't know if you wanted to respond to that as well.
Correct. I would say Kurt's right dead on. What happened is there was no discrepancies, but with the crosswalk, it takes a couple months. And then at the time, we had just crossed over into Tyler Muniz as of October 1st. So we were in the middle of the migration with Tyler. So we really did not get into the Bentech world officially until about January. January was when they started going back and forth with the files mostly. And then with the files transferring back and forth, We had to verify and go back and forth with the providers and correct anything. It could be any discrepancies from social security numbers to a dependent name that may have not been spelt correctly in Aetna or Solstice compared to our end. So that's kind of like what takes so long with the verification. But our target goal from the beginning of last year was open enrollment. So we're right on target right now.
Okay, that's all I have for now. Thank you.
Anything else from council? Ms. Miller Anderson and then Lawson.
A question going back to one of the slides that talked about the various items that have increased, such as the medical pharmacy and inpatient stays and cancers and those various things. Is that across the board in terms of the county, the state, the country, or is this like really abnormal? I understand it's different from our past last year, but are we seeing this across the board, or is this something we need to be overly concerned about in terms of, I mean, I don't know if most of these people live in Riviera Beach, or, I mean, is it our facilities? I mean, is there a little more information in terms of, is this an anomaly when we're compared to other places? Or is this something that is trending across America or the county or the state for that matter?
It is not surprising the medical pharmacy cost increases, because this past year there have been several medications, oral chemotherapies, and different forms of injectable chemotherapies that are coming into place. So that there is not abnormal. The abnormality that we're seeing is the amount of claims over $100,000. Typically, a group of your size are around 500. We usually see 4 or 5 of those large claims. In this instance, you have 13 that are over $100,000.
And the 4 or 5 that you're mentioning, that is normal across what board?
Across a group of 500 people. You would typically have 4 or 5 claims over $100,000.
Are we only looking in the state of Florida, only in the county, or nationwide, or what?
That's pretty much in South Florida. That's
I'm sorry. Did you say that a few minutes ago, South Florida? Because I totally missed that if you did. I'm sorry. I didn't hear South Florida. Thank you. So, okay. So it's basically we're looking at South Florida numbers.
Yes, ma'am.
Okay.
But in your instance, you have 13 claimants over 100,000. That's the anomaly. Yeah.
Right. No, and I get that part when we're comparing ourselves, you know, knowing that we didn't have that before, correct? But
correct.
Is 13 abnormal in other areas across the country? I mean,
for a group of 500, I would believe that it's excessive.
You believe,
and I typically don't see that in our book of business, which is Florida and the Caribbean.
Okay.
But when we look at your actual what is occurring in terms of the large claims, you have some things that could be preventable, but in terms of the types of cancer that are occurring, those are not preventable cancer claims.
Okay. And then could someone just give me a quick overview again of what is the HRA plan? I mean, I remember it. It was one that I did not really like, but why would someone want to go there? Because what would be a benefit?
Well, first, if they are an employee only, the plan is no cost to them, so there's no payroll deduction.
Mm-hmm.
And
for a family, though. For a family.
Sure, for a family, it has the lowest overall payroll deduction for them, and they receive the first $1,000 of their medical care at no cost to them. So the first $1,000 is absorbed by Aetna, and then they would satisfy the remainder of their deductible, meaning so they would pay the contracted Aetna amounts with their providers. Once they satisfy that deductible, they pay a co-insurance. So they pay a cost share versus a copay. So they pay 20% of the contracted rate. And then that all applies, that deductible and that co-insurance applies to an out-of-pocket maximum. And so that they are capped every single year. So they have no cost greater than $6,000 in a year if in the event they had something catastrophic. But you could have an instance where you do have a young, healthy family where they will not even broach that threshold.
Right, and that's what because most people who are fairly healthy will always pay out of pocket for most of their stuff.
Right.
They're not constant.
And then that HRA plan also, if they don't use that money, it'll roll to the next year. And then in the event they have something happen that year, then they can use those funds to offset their cost in that year.
Okay. All right. Thank you.
Mr. Lawson and then Mr. McCoy again.
Thank you, Madam Chair. Mr. Evans or Mr. Sherman, I want to take a look at this and kind of in line with what Ms. Miller Anderson was stating. Where is this cost essentially going to end? Because it just keeps going up and moving up, and we're transferring a lot of costs over to our employees, and it's really affecting their compensation and their ability to be compensated fairly. So we really got to find a means of how to end this constant increase, because annually this can't be reflected back on our employees and on our residents, because now we're paying this higher premium for our policy. That's another $534,000, and that's if we take this plan. So what programs, opportunities, what things can we put in place to assist, or does this need to go back out for RFP or RFQ? Because right now we can't continue to just pass this cost over to our employees and our residents.
Well, I can speak a little bit on it and then would defer to the expertise from the Gehring Group. We believe that because of our plan utilization over the last couple of years, that in the event that we would go to market, we would find ourselves particularly in the same situation, not to mention that there would be a service disruption if another book of business was selected, United or another entity. For our employees that are single, the cost is still free to them in the event that they do select the high deductible health plan. And in most municipalities and in most government entities, it is actually very common where employees are contributing anywhere between 3 to 5% for the cost for insurance, because this is something that has continued to go up. We don't see anything in sight that's going to reduce the number to a point where we're not experiencing any increases. The industry gold standard is to be anywhere between 65 to 80%. We're running at 130 or 115% in our plan. And so we're going to have to push wellness initiatives. We're going to have to do things that things that address modifiable health behaviors. We're going to have to get healthier as a workforce. And then we're going to have to look at the types of medications that can be obtained free, whether it's through Publix or other means, and really try to change the culture holistically. But as it relates to insurance, a lot of entities are only providing a high deductible health plan and then asking the employees to contribute for the cost as well, because of the increases that you're seeing because of the cost for healthcare to continue to go up. If we do go out to market, I would venture to say that our numbers are not good. In addition to, I've had some conversations with others about looking to form a co-op amongst other government entities, but our numbers aren't good. So we would adversely impact their rates based on the numbers that we're seeing. But Christian and Mr. Gehring, certainly from what you're seeing in the industry, what are some of the things that employers are doing to try to tamper down the cost increase? Because every year we're seeing, we're excited about an 8% increase, and 10, 15 years ago, you didn't have the increase that you're seeing now, to where 20% seems to be the industry norm.
And to that point, Mr. Evans, that's kind of my concern. To make this a norm, or to normalize this, is not really acceptable for our community. Health and wellness, as you stated, has to be a priority. But I mean, also the fact that we're a food desert. That's why we've really pushed these fresh food initiatives within the community over the last few months. I mean, healthy food and fresh food contributes to our wellness. The access to gyms and maintenance of their body, mental health. These are all the initiatives that we have to push, but that's not going to be an immediate fix for this year, as you stated. There's nothing that we can kind of flip the switch today and kind of bring our deductible down. But as you stated, our motto is Riviera Beach 2030. So what can we do within this budget cycle to change that? I'm just worried that we can't continue to just consider this 20% annual increase a norm for us. So, but if either Mr. Garrett, go ahead, Mr. Evans.
And Councilman, one of the programs that I'm in the draft stages about is that we are fortunate to receive money from Aetna to assist in wellness initiatives. And one of the wellness initiatives I'd like to put forward, and if Aetna wants to contribute more, we certainly would be willing to accept it. But we do want to look at working with any local gyms in our community that have business tax receipts, that are reputable entities, to say to our employees, hey, if there's an opportunity to utilize a gym or get personal training, that the city would incur the cost with the monies that are set aside for wellness related activities. The city would pay the first 4 months or what have you, and then the employee would be responsible for any time after that. Additionally, in my past experience, I have also had partnerships with gyms, that if an employee would go to work out, we would actually pay them an hour to go work out. So if their normal shift would start at 7 o'clock, we would say, okay, your shift starts at 8 and you have to go to the gym to be in a spinning class or anything like that, because we wanted to see the employee take initiative to, live a healthier lifestyle. We assisted in providing healthy dietary options. We removed snack machines. We did everything that we could to change the culture in the agency. And in subsequent years, we did see renewal rates not as high as they normally were. So we're going to have to be creative. We're going to have to be innovative and insert that consumerism into it, to where people think, hey, maybe I schedule an appointment with my primary care physician instead of going to the emergency room for triage, because we have situations that occurs. Now, we don't want to deter anybody from going to the emergency room, but just being smarter consumers is a big factor associated with it.
And with partnering with those gyms, if we can incentivize those employees, in addition to giving them that hour work off, but also getting tracking, whether it's going to be health and wellness, whether it's weight, whether it's blood pressure, whether there's certain levels that we could track with the actual gyms and say, listen, we're partnering with you and our membership for our employees, but we want to see every 30, 60, 90 days recordings and reports from these employees, and having the employees opt in and incentivize those employees to actually get healthier and to really work on their wellness. And then also with the development of our new city hall, looking into possibly putting in like a healthy cafe, fresh fruits, fresh foods at these locations. Even at City Hall now, having a fresh food truck that can come there. We have to really kind of curve the narrative when it comes to this, because every year all we're talking about is how we can, budget to increase this by 20% because our residents and our employees are sick, or they're not healthy enough to get a lower premium. So essentially, we can't keep telling our employees, this is what they have to do, but essentially this is what they have to do.
Ms. Thank you. Mr. Lawson, are you finished? Mr. McCoy? And then Ms. Lanier, sorry, I didn't see you. Mr. McCoy, did you have a question?
Yes, thank you. Thank you, Madam Chair. So I think that's a great idea, Mr. Evans, and also Councilman Lawson. You know, specifically, I asked last year, and I asked at least 2 other times since we've had this discussion about health insurance. What exactly has those wellness benefits? I think $30,000 or $40,000 were utilized for since we had this conversation last year, and nobody probably knows it. And I'm not even going to really expect an answer from it. But you know, to that point of Councilman Lawson's, I thought it would have been a great idea to do an on-site, you know, nurse practitioner, or at least a couple of nurse practitioners doing the working hours throughout the week. And at least that would almost address those primary care concerns. Because if you're looking at the medical utilization, it's surprising to see that the medical utilization is exponentially increased in terms of pharmacy and medical. In fact, primary care visits have went down. So, you know, I think it's important as an overall health wellness perspective to have gymnasiums, but, you know, from the standpoint of even, you know, I guess some of the requirements from our members in public safety and the collective bargaining unit and the random screenings that they have to go through. But what it appears is that I'm looking at cancers, cancer treatment, obviously medical, but the typical services that you would come to think from medical insurance is not what we're sending the increase in. But my question that I'm going to ask is, does anybody have those numbers on how many of our members that participate in this Aetna plan are actually employee only, and how many are employee plus one or employee plus family? How many that we're actually outright paying for? Yes, the city's covering the entire cost for. And even on that note, also retirees, which I believe they pay the entire portion, correct?
That is correct.
Does anybody know how many employees that we pay for?
What was the question again, Councilman? There was a little bit of feedback.
I was interested in finding out how many employee onlys do we have under our current plan?
I believe the Garin Group may have that. Christian, can you speak to that?
Yes. So there are currently around 525 total employees enrolled in the health plan. And just pull up my calculator. And 335 are employee only coverage.
Okay. So
112 families and 65 have plus one.
how many retirees do?
That is not broken out. That's included in that amount.
Okay.
And then we can get reporting from Aetna that we can get back to you on that would show where those claims are occurring, if it's in the employee population or the dependent population. But when I do look at I review your large claims, and a majority of the large claims are from employees, not dependents.
Okay, so if I can kind of just step back to where we were, I know what our FTE was for 1920, but how many actual, I guess this is the total amount then, that what is elected. Let's see. You have the total there, that's 10, 12, 7.
And those figures do include the CRA.
Right, so that's 402 is what I calculated, those numbers that you gave me. But is there any incremental or marginal cost? Because what I just totaled, 335, 112, and 65 is 402. I have a number of 529. Is that what this plan is based on? 525 employees? Is
It's
that based on
based
FTE?
Yes.
Is there any incremental cost savings as as we add more employees?
As we reduce employees?
No. So for instance, if we had a labor workforce of FTEs of 700, would that, because we have more employees on the plan, would that necessarily reduce the cost per member?
It depends claims to premium ratio. If you had 700 healthy employees that didn't utilize the plan, then we would see our numbers go down. But what happens is you have a segment of our population that does have some chronic illnesses, and so it all depends on the actuarial science, and they look and they calculate those numbers.
Well, I'm only asking because obviously there should be cost savings if you had a group of 10 compared to a group of 300. And I'm just wondering where that's at and how many of those individuals of the 525 FTEs belong to the CRA.
Yeah. We can certainly get that breakdown, and Councilman, to your point, one of the things we discussed on the staff level is to say, okay, what if we put together a plan that allowed for individuals to opt out of our health insurance, and we would pay them $100 per pay if they opted out into another group plan, so maybe their spouse. Well, the challenge is the individuals that invariably would opt out are probably those that are healthy, and then if they opt into another plan, that plan benefits, and then we have a situation where based on our employee populations, the numbers go up. So you don't really benefit as it relates to the modification. So we've looked at other situations and circumstances, how to tamper down those increase. But Ms. Jackson from Aetna can kind of give us a good perspective on what's being seen in the industry and how challenging this has been for a lot of government entities and what the industry is moving towards.
Yes. Good evening. Thank you so much for allowing us to be here tonight. And we certainly appreciate your business, and we appreciate the opportunity to partner with the city of Riviera Beach. Like the city manager said, it is correct. When you offer or give employees the opportunity to opt out of a plan, then you run the risk of a healthier person taking the option to maybe take the money and enroll in their employer's plan, their spouse's plan, or not enroll in the plan at all. And so you always run that risk of what is the mix of membership that you're going to have. Are you going to have more women? Are you going to have more men? Are you going to have younger people? Are you going to have older people? And being in municipalities, the unique thing about a municipality is most people stay and work for you a long time, which is great, which means they get older. And as we get older, we have health challenges. But there are positives as well, because you want to keep your employees, you want to give them rich benefits. So as Councilman Lawson mentioned, you just can't keep absorbing the cost. I agree. So then what you have to do is explore avenues of how are we going to mitigate this cost? Are we going to tweak benefits? Are we going to absorb some of the costs? And there's not just one magic bullet. You have to look at all of those things. And so that's what I believe Christian was presenting tonight, was options of how to mitigate some of that cost. While the city absorbed most of it for the employees because they want their employees to enjoy rich benefits, on the other end, they said we've got to try and tweak some of these benefits which are rich. And while they still are great benefits for your employees to enjoy, is a way of spreading the cost without straining the city's budget and without putting too much on the employee as well. Another thing that the city manager mentioned is exploring the wellness initiatives. And while it's not going to change things immediately, it is something that you have to keep working at. You have to keep bringing on initiatives along with us to give your employees incentives to live a healthy lifestyle, a better lifestyle, whatever is healthy for them. While they may have comorbidities such as high blood pressure, diabetes, these are illnesses that you can live with and have a good lifestyle. And so you want them to take their drugs, you want them to remain outside of the hospital. And that's where the wellness fund comes in to try and partner with these employees and help them to live a healthier life. While they're not going to be cured of that, they don't have to be as sick and end up in the hospital, which will increase your costs.
And councilmen and members of the council, I'm actually drafting the elements associated with a wellness initiative that we're going to look to release here probably by the end of the week, that speaks to some of the things that were discussed on this, because there's approximately $29,000 that HR has communicated to me that is available for the remainder of this fiscal year. So definitely going to look to create a program that we can pay in advance for employees to go get personal training or what have you, to attend, any of the local gyms in our community, and we would facilitate that. And then we would want to roster back as far as their attendance, et cetera, to, track how active our employees are. It's, of course, being, conscientious of the environment that we're in now as well. So no, nothing's off the table, but we know we have to do something because we can't continue to sustain these types of increases.
Council and City Manager, this is Kathy Aguirre, and I am the Market Head for Public and Labor for Aetna. And we are honored to be a partner. And I do want to make some additional comments. And we do appreciate your business. And the last couple of years have been challenging because we have seen your claims costs spike. We have been subsidizing your claims. And we do need to partner together to see what we can do to get folks more actively engaged and get in front of the member before they get sick. So from a high dollar claim perspective, we are managing those patients. We need to work with the members to get them to see the doctor before it becomes challenging. While you've had a lot of cancers, you've had a lot of conditions that are not normal in a group of your size. Typically, as Gearing said, it's 4, and you all have had a higher increase than the norm. So we need to actively, and we are actively engaged, and so is Gearing, in deploying whatever resources you need to educate your employees and to create the incentives necessary to get them to a doctor quickly before it becomes a challenge. And what the city manager has said is so important, to get people engaged in their nutrition, in their activity, in their health. There's a lot of obesity, comorbidities. It's more than the cancers. The cancers you can't control after you've been diagnosed, but if you find them early at stage 1, you can control the cost. So we're here as partners to work together, and we're here to continue to invest in your population. If you need additional resources than what we've already provided, we're here and open to provide them. So I just wanted to share that, and thank you for your business. And we're open for suggestions. We're open to giving you suggestions, to working with Gearing and the staff to help folks engage and be healthier.
And Madam Chair, to that point, I can tell you, and I had conversations with representatives from Aetna, they are trying to steer our employees to make informed decisions. Unfortunately, our employees don't pick up the call or return the phone call. And that is probably about 40 to 50% of the problem that we have in addressing the escalating costs, is that when information is being attempted to be provided and the insurance provider is reaching out to say, you may want to consider X, Y, or Z, or consider a second opinion, or what have you, we're getting little to no response back from the employees. And so that's why we're having some of the situations. So now, as you insert more consumerism into the situation, now that there is quote unquote more skin in the game, they're more likely to shop around and to listen to the advice and guidance that's being provided by other entities. But we do have a significant problem with employees not listening or picking up the phone when those types of calls are being made on situations that in some cases could avoid, thousands of dollars of cost of the plan.
Thank you. I think Ms. Lanier had a question. And Mr. McCoy, could you turn your mic off when you're typing?
That's not me, actually. I just turned it on.
You look like you were typing.
Someone's typing and I can't.
Yes,
hear
I thought it was you. I can't see
me.
any other mic on, so it must be someone who's not on the screen. So would somebody turn off their mic if they're typing? Ms. Lanier.
I just wanted to make a comment in regards to having a conversation about, thinking about going out for another bid for the city. I don't think that would be good for the city, given that we have triple the amount of catastrophic claims. We have an exorbitant amount of illnesses among employees, and going back out to try and find something lower, I'm afraid it'll probably be higher, given the fact that we're in the middle of a pandemic. Secondly, as we're talking about wellness issues, we can do. I agree with my colleagues in some of the suggestions that they made about the different types of wellness programs. We have the cities, the CRA has and the city has kicked in money for the Sow and Grow program, which is growing your own vegetables, and that also can be offered to city employees. We have three access to beaches in the city, which means that's a good walking and a good exercise for a program that can quickly be put together. And also, I know that Mr. Evans said that towards the end of the week he will be providing some outline of what they are going to do. But looking at you don't have to reinvent the wheel. Looking at best practices and looking at other municipalities and other corporations who have successfully moved their employees from health to bad health to good health. They have even awards for corporations who do that. So there are, materials and programs that are out there that we can mirror to be able to do the same thing with our workforce.
Thank you, Mr. McCoy. And then Ms. Miller Anderson.
Thank you, Madam Chair. I heard the date of August, late August. Was that for us to solidify a plan? Maybe Ms. Whittingham, was that you that said August 28th?
We are targeting August 24th through the 28th to conduct your open enrollment. That is considering this is approved on August 19th, that commission meeting.
Okay. So we're looking at a 19% increase if we stay at the current plan, and then 15.9% increase if we adopt what's being proposed here. Members, I think
it's 8.99% increase.
Where did I get 19%? I thought I seen that on the first slide.
19% was when we went and when we got from 30, we went to 19. Then there was discussions that we went to 15, and then we ultimately got it down to 8.99%.
Okay, but Mr. Evans, I guess, so let me back up. That's provided if we opt into this new plan that's being proposed today, the
That's
8.99%.
correct.
Yeah, so that particularly, I don't care for that plan. You know, what we're essentially doing, members, is we're just shifting the cost onto our employees. While it's 8.9%, but there's a proposal which, you know, we haven't exactly hashed out how that's going to work. That is going, which I think is, I'm not going to touch on it too much, but it's irrelevant to, or it's not germane, I should say, to exactly this conversation. But wages haven't increased at that same proportion, and you know, I really hate to be given 2 weeks to try to figure out a way for us to really strategically figure out what in the budget we don't need. Because I can tell you one thing, we've been in COVID now since March, so that's close to 6 months. And just like every other business in the private sector, we're starting to realize perhaps we didn't need that job in the beginning, or we didn't need to take on that service in the beginning because we were still finding a way to operate and provide our core services. But I don't want to necessarily water down what we offer to our employees by making them pay more for now pushing everybody into a high deductible plan or buying up into the copay plan. That's just not something that I particularly like, being that, you know, this discussion I would have rather had much sooner, because I think that there are some things that we can cut, but I don't want the very people who many of the members, actually all of the members on this board except for me, decided that they weren't significant enough to have COVID-19 pandemic pay. But now we're going to turn around and increase their health insurance premiums or force them to go into a plan. So, you know, with only 2 weeks left, you're kind of leaving us no option. But I would like to see how we can really put our heads together and figure out what need not to work, because, you know, again, these are the same people that, because of their collective bargaining agreements, weren't provided pandemic pay. And I don't think that this is, I mean, we're doing what we have to do because of we're doing what we have to do because of the current situation. But if we stayed at this current plan, that would be a $1.3 million increase. We spent that much in 6 months in just pandemic pay cost alone, and much of which went towards salaries. So, members, I'm just asking you to think a little bit more before you begin to consider just going along with what's been proposed. I would like to give our employees, if we can't always give them a 3% every year or a cost of living adjustment every time we turn around, we should be able to at least look and see where we can kind of trim the fat in some programs that perhaps are obsolete or are better suited, you know, in another avenue. But I don't want to sacrifice on health insurance, especially now. Every employee, all 525 FTEs, know the importance of it just because of where we are in COVID-19. And I just don't support it in its current form. And I think that there's more that we can do to work on this.
Thank you, Mr. McCoy, Ms. Miller Anderson, and then Ms. Lanier.
Well, I think it's a perfect time for us to keep those things in mind as we go along with the budgeting. Maybe there is something that we can cut out as we're moving along, because like I said before, I really do not like that other option. It really puts a burden on the employees in terms of what they have to pay out of their pocket. And I don't agree with that part for sure. So as we're moving along in the budget process, I mean, this is the perfect time to identify some of those things we can probably do without, so that we don't have to pass the cost off to the employees. I don't support having to do that. I do understand, though, that this is probably not the time to try to go back out. But I just, you know, I don't like being put in a position where I'm being forced into a situation only because I mean, this is where we are right now. And we know that if we went out, that no one would probably want to pick us up. Or if they did, it would be just as high. So I understand that as well. But I think this is the time now to really consider and think hard about what we're putting in the budget for different different departments and for different items. Maybe there are some line items we need to cut out, so that we're not having to pass that cost. So I think this is a perfect time to try to figure this out. I mean, I agree, 2 weeks may not be a whole long time, but we do have these budget meetings coming up. So we just really need to have a plan and think about what we're doing as we're moving along so that we don't spend a whole lot of time and can get it done in the next couple of weeks. I think we can do it. We just need to really focus.
Thank you. Ms. Lanier.
I agree with my colleagues in terms of looking to see how we can make it easier on our employees. I'm just afraid that going out to be to do another bid will definitely disrupt coverage of insurance and possibly even have increased costs. But on the other hand, colleagues, the CRA still owes us some money, so we need to look at that as well. We need, because if we're going to look at trying to able to make sure that employees are not taking the brunt of these costs, then there is monies that are there that we can look to help them with. But I just don't want to be in a position where we are either trying to go back out to bid or we may have a situation where we disrupt insurance coverage for our employees. But I certainly agree with looking at other ways in which we can ease the burden for employees. And I don't think that, and I would not agree to make that decision tonight to move forward. I think that we need to look at how we could do that.
Thank you, Mayor Felder. And then I think Mr. Evans wants to say something.
Okay, Mr. Evans, so if we do nothing with the policy, the city has to front the 1.3 million?
Yes, sir.
Okay, so as the colleagues say, do you see any way in the upcoming budget that 1.3 could be cut from other areas so that this doesn't have to fall on employees?
Yes.
With regards to reducing that $1.3 million, and just to provide a little bit of context, the money that was loaned to the CRA was $10 million, and that came from the insurance fund. So there was a fund that had cash, and so in the event that the city is to collect that revenue, that would go back into replenishing that fund, and then premiums could be paid out of that and to help reduce the actual cost for the plan. However, the one challenge that we have, if we don't make systematic changes to the plan design, the cost will continue to grow up. And then it becomes a situation where we are probably one of the few employers that don't have employees contribute for single coverage, whether it's 3% or 1% or what have you. That's very rare. The other side of it is one of the things you could look at doing is Aetna has seeded $1,000 for family and $500 for individuals. We can look as a city to say we can seed some monies for the employees as well, to have it to where all their out-of-pocket cost with the plan design changes, families may get $2,000 and individuals may get $1,000. And then once they hit that out-of-pocket max, then in essence, they go to the co-pay situation. So there's ways to possibly make some changes. We're just going to have to bring some other options to the table. But if we were to look to absorb that $1 million, that is going to adversely impact our ability to, there's certain operations and functions that will lose personnel because we have every year for the last couple of years have seen the increase in health insurance. And so we have to do plan design changes to be able to stem the tide, because these we're not even close to what industry standards are, where 80% is where we would want to be.
Madam Chair?
Yes.
So you say the $10 million fund from the CRA, is it possible to pull the 1.3 from that, or is it there?
The CRA has deferred payment and hasn't made any payment to the city as it relates to that. We did anticipate budgeting that money into fiscal year 2020 to start the process of reimbursing the city, but that money would be utilized to offset the cost associated with the health insurance. Now, does it take it down in its entirety, and how that works, I'd have to, work out with Mr. Sherman as far as what the numbers would look like. But as it stands right now, that money would have to go back into the same exact fund in which it was taken from.
Okay, thank you.
Commissioner Miller Anderson. Your microphone.
I was saying, Lawson, was he next or no?
Oh, I'm sorry, Mr. Lawson,
I
Councilman
think it
Lawson.
was
You're
actually
next.
Councilman McCoy and myself, and then Ms. Miller Anderson.
Okay, thank you. Go ahead.
Thank you, Madam Chair. And, to that point, there is a lot more comprehensive discussion that has to be made aside from all of our insurance professionals on the line. But, but one of the things I want to point out is what was important in our analogy. Obviously, Mr. Evans, if you're going to propose or proffer something like us providing those incentives, is, I guess when I was taking notes, I was trying to figure out, and this is something I would have asked that perhaps Aetna or the agent of record come back and tell us is, of that 402 that we currently have that's receiving coverage, at least for this current fiscal year, the number of employees like that have these high dollar claim amounts, because on average, I can only imagine that this is going to be a handful out of 402. And I'm just really speculating, and I'm shooting from the hip here. We'd be lucky if we have probably 30% or maybe 30% of those employees that are really driving those costs that high. I don't generally see that we have that many employees that are running this cost to premium ratio that high. So proposing something like that sounds good, but if it's only a small amount or a small population of the group, then how does that really benefit us by adding an incentive when, and I guess the tough part is trying to word it in, if there's a small population that tends to get more medical treatment than, the remaining 60 or 70%.
Well, and I would have to defer to Christian and Ms. Jackson, but the reason that we were able to reduce the cost from originally 30% down to 8.9% is really predicated on the plan design changes and more consumerism being inserted into the process, because we have situations like we have the comorbidities, we have the high dollar claims amount, we have a situation where our employees are not responsive when they're being attempted to be coached on those issues. And so if we don't make some changes, invariably we're going to find ourselves next year talking about another 1.5% increase. And so it's going to, and we are seeing local governments, some local governments only offer a high deductible health plan, and that's it, because of the cost for all the other buy-up elements. So I would defer to the representative from Aetna and Christian from the Garin Group to talk about those elements.
Well, sure. Those plan design
Go ahead,
changes
Christian. I'm sorry.
were made in a thoughtful manner. Is that those plan design changes are only going to impact those that are the high dollar utilizers in the plan, versus those that are the low dollar, less frequent users of the plan. So, which is a majority. So as we saw, a majority of the claims are not being, a majority of the people are incurring the least amount of claims. So there's very few people that are incurring the majority of the claims. So those were those individuals that we're impacting with these changes.
And also, when you make benefit changes, you're trying to do behavior changes. You're trying to catch these people in the sweet spot. So like Christian mentioned, The ones who are giving most of the cost, the 20% that are costing 80% of the cost, driving 80% of the cost, you want to share a little bit out of pocket, push a little bit on them. But at the same time, you now want to incentivize those who are not sick yet to have better steerage and choosing a lower cost setting, maybe having healthier habits. And so you're trying to catch these members before they get too sick. When you talk about high cost claimants, people who have cancer, they need radiation. They need the high cost drugs. So they're not wasting money. However, the best way to do that is to try and manage them on one end. And then on the other end, where you have the healthier employees, you want to try and mitigate them from getting sicker by helping them to go get their visits at their physicals each year, take their drugs to make sure they stay out of the hospital. So benefit changes are meant to steer people into making better consumerism choices, but at the same time, it's to share the cost for those who are costing the plan more.
Anyone else?
What do we go? I guess
Mr. Evans, go ahead, Mr. Who's talking, McCoy?
I just wanted to know where we go from here, Madam Chair.
Madam
Mr.
Chair,
Evans.
the intent behind staff is obviously to share the elements associated with this. We hear the concern and the comments with regards to what the board has articulated. We can look to be prepared to have the follow-up discussion with the board again at your next regular meeting, not maybe bringing something for you to execute, but maybe something to have additional conversation with additional documentation to help provide a clearer picture on the plan design, how it will work, and who would be impacted. And then we can look to take it from there based on the direction the board provides to staff, as well as looking at what the fiscal impact would be if the city was to absorb the additional costs and not do any plan design changes or modifications.
Thank you. Is this yes, last thing.
So, Councilwoman Lanier, I don't know that there's necessarily a parallel or a relation between going back out to bid and the cost increasing. Obviously, at this point, it's an industry trend. So, I mean, that kind of, in my opinion, doesn't necessarily, I don't think that was accurate. And Mr. Evans mentioned that we're probably one of the only ones that don't require much buy-in by employees. And that's partly because we failed with cost of living adjustments. And also, what are the other things? The compensation study adjustment. So, in pay increases, and a lot of these people are still, fighting after 22 years, and they're probably making $40,000 to $45,000 less than some of our peer organizations. And I've seen that twice just this month alone. So that, I think, is what separates us and why we should really take a critical look, because if we can't always offer a pay increase, at least I want our benefits, or at least our employees to feel confident that they have a solid plan and it's not going to cost them, additional 10, 12% of their gross income to support a family plan every year. And that's all I have.
Thank you. Mr. Evans, if there's nothing else, I think we can move on.
Thank you, folks from the Garing Group, and Ms. Jackson from Aetna, and those that are on the line. We're going to go ahead and transition into the
Sorry,
budget
Mr. Evans, I
presentation.
apologize. Just a quick interruption. Madam Chair, we had myself comments, and then I believe it was Miller Anderson. And last minute, I believe Ms. Lanier just raised her hand as well. So
I'm
we had a
sorry.
few
Go
additional
ahead.
comments in regards to this
Go ahead.
topic.
I thought we were done. Go ahead, Mr. Lawson.
No problem. Thank you, Madam Chair. Mr. Evans, or actually, I'm not sure if Ms. Jackson or who would be able to answer this, but are the costs based on the FTE counts or the actual physical number of bodies on premises?
the cost is predicated on claims to premium ratio as well as FTEs. But also, if you reduce your FTE count and you have individuals that have high dollar claims, you're going to find a situation where you may see your costs actually go up, depending on the situation. Is that correct, Ms. Jackson?
Yes, it is. And it's also based on, there's another component there, which is utilization, which is what drives what your initial rate is. And then based on the number of employees you have enrolled in the plan is how you spread the increase out. So Ms. Evans is correct. Depending on who actually stays, if you have a bunch of healthy employees who leave off and you have sick people remaining, your costs could still go up. But so all of those play a part in how you come up with the cost of how the increase comes about.
So if we could, Mr. Evans, incorporate just a cost based upon, I know there's gonna be some positions that are gonna be eliminated from this budget cycle. I'm not sure how many, do you have an idea of how many we're talking about of eliminating positions from this next budget?
The number will be shared in the next presentation, and I believe it is 46.
Okay.
Evan,
So-
my calculation was 85 yesterday based on the FTE count that was provided.
No, it's 46 because probably when you look at the benefits associated with it, and I'll explain that in the next presentation.
So, and then I guess my question would be, would this factor into our costs, and what would our costs be with these 46 eliminated positions? And if that'd be beneficial, and that would kind of help with making a determination if we needed to go back out for a bid or not. So if we could have that information as well.
Yes, we can certainly provide that information, but you'll see that most of the positions are vacant. So, there may be, some recalculations as it relates to the numbers, but I don't anticipate it reducing the cost any, by a large amount. But I think we are paying close to, Christian, based on the plan that we have right now, aren't we paying close to, I think, $1,000 per employee per month?
You're paying $950 per employee per month.
So in some cases, we have situations where we're paying more for health insurance than maybe even some employees make in their paycheck.
Thank you, Ms. Evans.
Councilwoman Miller Anderson, did you have a question?
Yes,
Or
Mr.
comment?
Evans, yes, or Mr. Booth. Have we reached out to the employees? Like, I know you send out a lot of emails, and I can, for one, say a lot of times I don't always read them all, so I miss some things. But I'm talking about coming from your department because they're very informative, but there's a lot. But do we reach out to the people and actually have a conversation with them in terms of, what their costs are? I know Mr. Evans said that Aetna tried to reach out to them, but it's a little different coming from the inside. If we're able to do I don't know, are we able to do like a one-on-one counseling, or at least provide Aetna an opportunity to say, hey, can we, pre-COVID, come to the office? But now just being able to give that one-on-one counseling. Sometimes I don't think people, you have a card, you go to the doctor, you go get your prescription, and you don't really think about, what you're doing. You just do it. Yeah. But if it's really brought to you, sometimes you might think twice.
Yeah, and I would defer to Mr. Good to speak on that. But I think the other side about having Aetna call, it's so personal that sometimes, they prefer to talk to somebody that's outside of the agency versus, but Mr. Good, if you can speak to what you do in your particular office.
I could also say, I guess basically one of the benefits of me working with the agency is I do have that one-on-one contact, and I kind of know the pulse of the people, our staff members. So a lot of times if they do have claim issues, or if they're trying to figure out what plan would be the best plan or what route would be the best route, I work with them. And then we have one from Aetna. He comes out twice a month. So a lot of times we do set up a lot of one-on-one interviews, not interview, but one-on-one counseling sessions to try to assist the members when they do know they're either currently going to have a high surgery or something like that, or either they're just looking to get healthier.
And have we seen where that's been impactful? Has it made a difference or decrease in anything?
I can see within the last year, and that's since we switched over to the high deductible plan, the direction, because the high deductible plan is more of a consumer driven. So the calls have gone up because a lot of times the employees want to be informed before they make a decision, rather if they're going to have an outpatient procedure or if they're going to go to a hospital. So I can say on this end, and if you look at our claims, I believe it has helped us out a lot.
Okay, all right. I was just wondering if, there was more that we could do in terms of the education piece to kind of help people in terms of, hey, you're getting to this point, maybe you want to look at doing this, or, other than having a different healthy lifestyle.
Pre-COVID, we had, and we were partnering with Aetna this year, we had a very aggressive wellness plan that we were working on. And we even had set up where we were going to have a wellness committee, and every department was going to have their own little wellness coach. That was pre, the pandemic. But, after the pandemic subsides, we'll get right back to it. But that's the goal. With the high deductible plans, it's going to be a 2 to 3 year, goal to get the group healthy again. It's not, there's no magic elixir that's just going to happen overnight. But just what you're saying, they're going to have to do the counseling, and with a partnership with Aetna, we should be able to lower it.
Okay, thank you.
Mr. McCoy.
Just one word for thought: austerity. That's all I have.
Any other questions? Ms. Lanier, are you? Go ahead.
Yeah, I just wanted to briefly say that, Mr. McCoy, you made an allusion to when I talked about if we go out to bid, there could likely be an increase in cost anyway, and that's what I meant. I didn't say there was a correlation between the two. I said if we make the effort to go out to bid, that we can very well have increased costs based on our high cost of individuals who are sick. We are in the middle of a pandemic. We have catastrophic claims at 3 times the normal amount, and that if we make that effort to go out, not saying that we don't, or that we don't have to, or that we can or not, I'm just saying that we still run the risk of higher costs.
There's no risk. I've never purchased for a car at sticker price. You can always negotiate, and especially with the internet.
I mean, you know what, Mr. McCoy, it's just like if you got car insurance and you keep having accidents, and you say my insurance carrier, I mean, Allstate just keep, my premium is so high. You think I'm going to go and get something different? It's going to be about the same amount, and it might even be here because it's happened to me before.
Right, but we still have the 8.99% that's on the table, so it doesn't hurt us that agent of record.
I did not say that. I did not say that we could not go out. I said that we still run the risk of it being high.
What? We have the 8.99%. And if it's higher, we can always revert back to the 8.99%. Is all I'm saying.
Well,
is there anything else? Anything else pressing that we can?
Actually, it is pressing. One last thing.
Yes.
I hate to say I told you so, but I told you so, and that's all I got. I wish I could really technically drop the mic, but literally, this is what I tried to caution the members on 3, maybe 4 months ago when we thought it was okay to approve a policy. Well, actually, we didn't approve a policy, but we now basically unbudgeted, spent $1.6 million, and now we're sitting here trying to figure out and gamble and roll the dice with our employees' health. So, this is
and I'll say this too. I mean, interrupt you, Mr. Cobb. I didn't mean to interrupt you. But what I will say is that there's $10 million sitting at the CRA, and while we're crying about higher rates, there's money over there that we can also use to be able to make up some of the difference. So that is it.
And Madam Chair, as a point of clarity with regards to the pandemic, that was funded from existing budgetary funds in the fiscal year 2020 budget. So the insurance increase is predicated on actuarial science and based on plan utilization and plan design. That's where the costs come from.
Oh gosh, no. So now we got to really debate this, right? Because if it was in the existing budget for positions that weren't filled, you know what happens at 9:30? That money rolls over to the next fiscal year. So obviously there were positions that were vacant. But my point is that we have to look going forward. Obviously, the pandemic is still going on. In fact, we're probably not even a quarter or a third of the way in, and we're going to have more costs. We're going to have more people actually being diagnosed. But now we threw away $1.6 million in the first 5 months, and we're here at this point. And you know, it's not a popular subject, and I can say I'm not a fair weather politician to care about what people think. I just am convicted by my conscience and doing the right thing. And I just think that had we been a little more conscientious in our decisions, we wouldn't have so much heartburn about whether or not we increase it on employees that make $25,000 a year and then asking them to pay more for their health insurance. So that's all I have, and I yield back.
Can we move on to the next subject now? If there's no other question, we can. Thank you. Mr. Evans.
Yes, I'm loading up the PowerPoint right now as we speak. Okay.
Madam Chair, I have a question.
I'm sorry. Yes.
This second part that we're doing, is this the one that has 116 slides? We're doing all this tonight?
We're just going to try to get through fire tonight.
Okay, thank you. All right.
No problem.
Good question.
Excuse me. Is it okay for the Garin group to drop off?
Yes.
Thank you.
So much.
Thank you, Garin Group, for being here for an hour and 17.
Okay. Good night.
More than an hour and whatever. Thank you.
Thank you.
Good night.
Well, Madam Chair and members of the council, this is a continuation of our presentation as it relates to the fiscal year 2020, 2021 budget. Brief overview, then we'll go into city overview, go into department overview, budget calendar, and question and answer. But we're going to just stick to the fire department today. So this is the slide that we shared with you all earlier to look at the historical millage rate versus the linear line. Showing that the millage rate has in fact decreased since 2009 or 1999 to 2020, but the taxable values in the city has gone up 295%. This is the chart that we look at as it relates to FTEs, and I wanted to point this out: actual FTEs and budgeted FTEs. So if you look from fiscal year 2016, we had 134 budgeted FTEs where you actually had 108. And so this is where you'll see the difference and the deviations. Here in fiscal year 2020, we had 500 FTEs and actually positions filled 425 FTEs. In 2021, the number with the proposed reductions is 456.5 FTEs, and that's across all funds. So as you can see, there is those gaps between what has been requested and positions that were vacant and have not been filled throughout the agency. And what we also are going to do in subsequent budget cycles, that as attrition occurs in the organization, we would look to make modifications to possibly reduce those numbers. So this is the FTE position summary by department. This is the changes per department holistically. For the general fund departments, you can see that in FY 2019-2020, it was 500 was the complement, and that's going to go to 456.5 with a reduction of 43.5. And then when you incorporate the other funds, you have a reduction of 3 persons, which brings your entire staffing complement across your enterprise fund and the government entity at 526 and 50. The chart that I showed you spoke to specifically to the general fund, where you saw the numbers that were reduced. Moving into the next slide, and I think it's important for us to reiterate the point that 60% of the revenue collected by the city is ad valorem revenue. That is property taxes. That's a large portion of the revenue. But some of the challenges that we experienced as a result of the pandemic are $437,000 reduction in intergovernmental revenue that's collected from the state in our revenue sharing. You can see our investments earnings. We lost 56% or $325,000, and then miscellaneous revenues, you've lost 10%. So the impact to the city was great with regards to those particular items, which got us into the point where we were in that budget shortfall of $1.9 million, but was able to provide a balanced budget for the board to consider. The budget from fiscal year for the general fund from fiscal year 2019-2020 is going from 77 million to 81 million, and it's a increase of approximately 4.69%. This is the breakdown as it relates to the revenue projection, similar to what you saw yesterday. Property tax revenue being the lion's share, and the other revenue streams that the city collects, charges for fees or for services, which being another bulk of the revenue, general revenue that's collected. When we look at our expenditures as it relates to departments, you can see a bulk of your expenditures are related to public safety, 19.1%, and PD 27.86%. And then this breaks down all the other departments throughout the city, and as well as transfer to debt service. So going into the overview, the composition of the organization, of course, the residents of the community, property owner, and businesses are on the top of the pyramid there. You have the city council. The city council in the city of Riviera Beach. Whoa, I don't know what happened there. Let me go back. My apologies for that. All right, so this is the org chart. Speaks to the 4 specific sectors just for the purposes of this org chart. Administration, which includes finance, city clerk's office, human resources, procurement, information technology, public safety, is police and fire, infrastructure, public works, development services, and utility district, and culture and recreation, parks and recreation, library, and the marina. This is a projected expenditures for 2021 by department. So it goes from your police department, your largest department, to your smallest departments would be procurement and the city clerk's office. So that's the expenditure amounts for your general fund departments. And then we're going to get into a department overview. And at this time, I'm going to turn the presentation over to Chief Kurd. And Chief, you should have full control over the presentation.
Thank you, Mr. Evans. Good evening, Council. Can everyone hear me okay?
Yes.
Great, thank you. I want to be respectful of your time, but at the same time, I also need to make sure that I articulate some very important points. There's going to be decisions made by the council over the next couple of weeks that are going to set the trajectory for fire rescue over the next 20 years. So I want to make sure that we go through this information. While I go through it as fast as possible, and these points here were a culmination of different presentations that have occurred over the last year. Mr. Evans is not providing me with the control.
Ms. Miller Anderson might be having a question or trouble.
Well, I'm not having trouble. Chief Kurt is having trouble with his volume. So
Yeah,
I thought it was me. I thought it was
control the
me for a second.
presentation here.
It's going in it. It's going on mute. And
Yeah,
cutting out.
it was coming back and it was coming in and out. And I also was wondering if Walter might be able to take the rest of us off camera so folks can focus on Chief Kurt.
Okay.
Would that be,
Chief,
well, I might just turn my phone.
No, we keep everybody on here, make sure everybody stay on here. People disappear when we don't show it. Yeah, that holds us all accountable.
All right.
No,
We get it, Walter.
Chief, is that you controlling it?
It's not quite allowing me to get that full control. If you can take me back to the beginning, I think I've been able to work it out.
Yeah, I think you just arrow the space bar. That may let me get you to the top. There we go.
That's fine. Yep, thank you. So basically what we are looking at here is a culmination of presentations that have been made going back to December. And actually some of these conversations have been had since Mr. Evans' tenure here the first time with Chief Duran, trying to move the organization in the right direction and come into compliance with some federal standards. These are the basic four services: fire, EMS, ocean rescue, fire prevention, and inspections. Looking at this year's budget, what we've looked to do in budget modifications is an addition of 3 firefighters to maintain current staffing levels at Station 89. Station 89 on Military Trail was never a fully staffed station. And after we had some of our issues with Station 88 and movement of crews, we did recognize that there were some safety concerns with our firefighters, and there was also some concerns with response times. So with Mr. Evans' blessing, and fortunately we were able to utilize monies from our existing budget, we did increase that station staffing by 3 firefighters. Now, when I say 3, I'm only talking about 1 more every day, because we do run a 24/72 operation. This allows us to run an engine and a rescue to provide full service to Zone 89 Military Trail. We've created 1 executive assistance position that was put in last year, Ms. Devania Jones, who's been providing an exceptional service to fire rescue, and we couldn't be doing what we're doing right now without her. We have looked to reduce the overtime budget. We do feel that if we can get all of our promotions in place and we can hire all of the firefighter vacancies that are needed, we can definitely reduce overtime. However, our overtime budget is out of whack this year because of COVID-19. We have a COVID response vehicle on the road, firefighters that were participating in COVID testing, mass distributions, giveaways. So we're going to look to try to rein that in a bit. And come October 1st, because of some of the budget reductions, we will be pulling the COVID response vehicle off the road, because that is not a staff position, which was one of the positions that we'll be talking about throughout this presentation as an EMS captain. We've also implemented a fire assessment fee fund, which we're talking about the possibility of how we're going to be able to fund our organization moving forward to provide the service to our community that we feel they deserve. It's not going to be an easy task, but one of the things that we do need to understand is our citizens have a very high demand on our service. And we'll see that as we go through some of these slides, but that is an option that we're going to be looking at, to look at options for additional funding. When we look at our operating budget here to the right, we've seen our budget from change going up simply because of those 3 firefighter positions, because of the executive assistance position, and we've also built in the funds for negotiations that are occurring this year. So we are in the midst of contract negotiations. Our personnel staffing, the FTEs, operating is roughly in that same ballpark. Capital is remained in that same ballpark, but clearly there will be some significant capital cost when we talk about rebuilding these fire stations. Our FTEs have gone up by 4. That 4 is no more than the 3 firefighters we discussed, and also the executive assistance position in our front office. Our goals for FY 2021, I'm just going to be frank, it's going to be to continue to maintain the same level of service that we've been providing and to provide facilities for our firefighters. We are not going to be able to grow. We are not going to be able to seek accreditation. We are not going to be able to improve our ISO rating. 3/4 of our fire stations are barely inhabitable. No, 2 of them are barely inhabitable. One's in a trailer right now. And we have a 4th station that needs remodeling that is approaching 25 years old. And we were just informed today that we have major sewage backup in that station. The septic tank in the drain field needs to be replaced at that station. So these are some of the issues. While the station 89 appears to be a newer station, that station was built, completed in 1998. That's a 25-year window. So it's going to need the same level of care we should have been providing to our other stations so it doesn't fall into disrepair as those have. Capital projects for this upcoming year are going to be construction of Station 88. That is priority number 1 in my book, and I believe it is from the information that I've gleaned from council on where our direction for our firefighters is. And also replacement of expired firefighting bunker gear. We were successful in receiving $350,000 in appropriation fundings that were submitted for a cancer reduction bill. Unfortunately, when that made its way back to Florida, Governor DeSantis vetoed over $2 billion worth of appropriations funding that included our firefighters' bunker gear. So we've actually shifted monies from the maintenance of Station 89 to purchase bunker gear. So I have the tough decision to determine, do we replace the roof at Station 89 or do I provide the firefighters with bunker gear that is suitable for the conditions that they're in? And as of right now, I've opted to go with the bunker gear needed for our firefighters. Let me get to the next slide here. Okay. Moving into this presentation that was given in December, many of you all either attended the workshop or I'm sure watched that workshop in early December that we had at the Clean and Safe building. These were some of the items that were discussed. I'm just going to touch over these items and I'm not going to go in depth. If you'd like me to, I could, but I'll keep it brief and to the point. NFPA is the governing body that provides recommendations for fire departments as it relates to operations, staffing, tactics, and strategies. So that is definitely something that we want to keep an eye on. OSHA also provides guidance as it relates to workplace safety. One of the things that you can recognize right here is OSHA has what's known as the 2 in, 2 out rule. So if we have 2 firefighters go in the structure, we need to have 2 firefighters on the exterior of the structure in the event that they become incapacitated due to building collapse or what have you. There is somebody on the outside to rescue these individuals. Please understand, we only run 2 firefighters on an engine, 2 firefighters on a rescue truck. One of those firefighters on the engine is operating the pump panel. That leaves me with 3 firefighters. We don't have enough firefighters to initiate initial fire attack or perform initial search and rescue because by OSHA standard, we don't meet the 2 in, 2 out rule. I'm here to tell you today that our firefighters many a times tend to overlook OSHA's 2 in, 2 out, knowing their backup is around the corner, and they're going to go in and initiate that fire attack or make that rescue should it be needed. NFPA 1710 discusses occupancies and different types of occupancies. This is very important because depending upon the type of occupancies that are within your municipality, that drives the number of personnel and firefighters you should have on each unit, and it's clearly a low, medium, or high hazard occupancy. Looking at our high hazard occupancies, we have 53 high-rise structures in our facility, in our municipality. We have CSX and FEC railways that carry God only knows what in the middle of the night. Amtrak railways with commuter transportation. We have an interstate, 3 cold storage facilities. I don't need to read these to you, but we have power plants, port centers. All of those are considered high occupancy hazards. High occupancy hazards are also considered high occupancy risk targets. We have the Department of Homeland Security, and these facilities have been identified to us by the federal government on areas that we should pay particular attention to that are considered high risk or valuable targets. So we have a Homeland Security facility in our city. We have the VA hospital. We have the Port of Palm Beach, United States Coast Guard, and also a military contractor in Lockheed Martin. Educational facilities in Riviera Beach, in 7 square miles, we have quite a few schools in our municipality. These are high risk targets that we must be mindful of within our community. Medical facilities in Riviera Beach, we do have the VA hospital, Edward J. Healy. We have assisted living facilities. We have Kendrick Hospital, Palms Edge. You can see that there's definitely that concern of those medical facilities. Oddly enough, and places of worship are considered high value targets for people to look to bring, chaos and mayhem to our community. When we talk about medium hazard occupancies, these are all of our industrial areas. We have quite a few of them, not to mention the Broadway corridor, but these are all been identified, or these zones have all been identified as medium hazard occupancies. One of the things we talk about in Riviera Beach is we are a small city with big city problems. We're going to have to make a determination who we are and what are we going to look like moving forward. Are we going to be that little department that provides a base level service, or are we going to look to provide that full service to our community moving forward? Historical staffing concern discussions have been brought to the council since 1991 with Chief Wester. He's brought that to council multiple times. Chief Perry's brought it to council. Chief Dern's brought it to council. And I'm now here bringing it to you, addressing these concerns, which are basically revolving around my firefighter safety. And I take that very personal when we're talking about their staffing levels and their safety. ISO ratings are basically a classification done by an independent for-profit organization that determines insurance rates within our community. We've been very successful in decreasing our ISO rating, which has brought insurance savings to our community. However, I can tell you we have hit the ceiling at Class 2. We don't have the facilities, nor do we have the firefighter personnel to be able to achieve Class 1 rating. At our fire stations, these are basic staffing models that we have at each one of our stations. 2 engines, 1 engine, 1 rescue at each station, with 2 people on an engine, 2 people on a rescue. These stations were built 1972, 1978. Here, Station 88 was built in 72, which is now gone. And we also have Station 89 on Military Trail that was built in 1998. And we have now upstaffed that station to provide an engine and a rescue complement to our Western community. Recommended staffing models by NFPA standards. They give definitions of occupancies and different type of hazards that may be encountered, but basically our primary function is to bring firefighters and equipment to the scene to put out the fire and save lives. NFPA 5.2311 there in the middle. These companies shall be staffed with a minimum of 4 on-duty members. I have 2. We're at 50% of what they consider the minimum staffing. We do think we can be functional with 3 because our firefighters are exceptional, but you can see what these standards lay out. And in jurisdictions with tactical hazards or high hazard occupancies, they're actually asking for 6 individuals per truck. So those are some of those bigger, heavier rescue trucks that you see in other municipalities. We do know some of these numbers are unrealistic, but we definitely can do a lot better of a job trying to get to these numbers than we have been. NFPA 1710 outlines EMS. EMS is going to be a minimum of 2 EMTs, 2 paramedics. While that's 4 individuals, we do feel we can get it done with 3. When we look at countywide unit staffing, you can see Riviera ranks at the bottom. We only have 2 people per rescue unit, and on the suppression unit, we have 2, and we have the 3 there because our aerial truck that does run out of Station 87 does have a 3rd person on that truck. But you can see all of these other municipalities, not only are they staffing with 3 most of the time, their suppression units, their rescue vehicles are staffed with 3, on occasion 2, but even those departments staffed with 2 will upstaff to 3 based on individuals being on vacation. Most municipalities have EMS captains and rescue lieutenants, except for those smaller municipalities. So you can see again here, we're kind of on this verge of we're bigger than a small department, but we're smaller than a big department. And we need to find that happy medium for our community that we serve. Palm Beach County provides a 3-engine, 3-rescue service to all of these municipalities. If these municipalities get it, I don't see why our municipality can't provide it to our residents. We look at annual call volume. In the last 9 years, we've increased our call volume by 27%. We are on pace this year, to run over 8,000 calls. And with COVID, we could be approaching the 9,000 call mark. We have not increased significantly or proportionately to the number of calls that we've increased over a 9-year window, but we've been able to hold strong with what we have. Looking at our call volume, here we are right in the middle. We're bigger than Green Acres, we're bigger than the town of Palm Beach and North Palm, but we're not quite Palm Beach Gardens or Boynton. There has to be a happy middle there. And right now we are providing services of these 1, 2, and 3 station departments when we're truly a 4-station department. But one of the things that's really interesting, and this ties into a slide you all saw that Mr. Sherman presented yesterday, is the amount of money per resident that is charged for public safety. This is our calls per square mile, basically calls per capita. We lead Palm Beach County in calls per capita. Our community is very dependent on our services. We just had a very long, robust discussion about health insurance. When I grew up in a community just like Riviera Beach. And if you had health insurance, where I came from, you had one of those good jobs. One of those good jobs provided you health insurance. A lot of people in our community, which is a known fact and something that we're trying to make better, don't have those good jobs. They don't have the health insurance. They don't get to go to the doctors for their regular checkups, see a specialist, follow up with the cardiologist, do a stress test. What they do is they wait till their condition becomes unbearable and they call 911. And oftentimes it's too late for that individual because that disease or that pre-existing condition has gotten to a point where it's ultimately going to take their life. You can also see here in some of the other slides, we're going to have some subsequent conversations about that. But this is basically talking about residential structure fires, what our responsibilities are. I won't read a PowerPoint to you. We've seen all of this, but our job is basically to get to the fire and put the wet stuff on the red stuff. What is very important is this slide here. This is a version of a time temperature curve, but this is a time property destruction curve. At 10 minutes, and you can see where our curve is based on when the fire started to 100% of property damage. We strive, and we've done a very good job of maintaining our response times under 6 minutes. You can see where that puts us on the curve. We usually can keep a residential structure in that 20 to 40% damage range and not lose the whole structure. Once you eclipse that 9 to 10 minute window, you then lose control of the fire in the room of origin, and it then spreads to the rest of the structure. That's when you start seeing significant damage. But more importantly, despite the significant damage, and I've lost my controls here. Have you taken them from me, Mr. Evans? There we go. This is the number of civilian deaths and the flame spread rate. So when we're on scene in that 6-minute window with the appropriate number of people, we'll tend to see fires confined to the container of origin, which is a cooking fire, pot on the stove, dryer fire, or we can contain the fire to the object and or the room of origin. So we're talking anywhere from 1.91 civilian deaths to 0 deaths per 1,000. If we don't have crews, adequate number of crews in place within the first 10 minutes, we know that that fire extends beyond the room of origin. You can see on the 4th one down, beyond the room or contained to the floor, it goes up to 22.73 deaths per 1,000. We've been very fortunate, and I'll knock on wood, we have never even come close to the 1.9, and I want to keep it that way. But we are at a very fragile state in the fire service, and we're bending, but we refuse to break. These are the personnel that are needed for different types of fires. 15 is basically our whole city. When we talk about open strip malls, garden-style apartments, or high-rise condominiums, you can clearly see we are nowhere near the staffing numbers needed to combat these type of fires. We are able to do so with our mutual aid agreements, but we have to understand that those units are coming only if they're available, and they're coming from remote locations. These are some of the initial critical tasks that our fire personnel can accomplish once they arrive on scene. What bothers me is this next slide. This is when we exceed the number of personnel that we have. We can't, and we are not doing these things. We don't have a safety officer. We are not conducting an immediate secondary search. Our crews that do salvage and overhaul are the same crews that fought the fire. They go back out, they get some water, they put another bottle on their back, they go back in the fire. That's not the way we should be doing business. We have very little exposure protection capabilities. These are those additional bodies that we're going to be talking about that are needed for us to be able to provide that full service. Now add in one civilian that we pull out of a fire in cardiac arrest or that has severe burns. We don't have the manpower on scene to be able to treat these individuals. We'll get into some of these station designs. You've seen some of these renderings. This was a rendering of Station 86 on Singer Island, what it could look like in our community. We've also talked with Mr. Sherman and Mr. Evans about some possibilities of relocation of this station and looking at some additional funding options to maybe entertain some P3s that might help us subsidize these costs. This is Fire Station 88 that we're looking to build on the corner of Military Trail and Congress. This is what is indicative of what a fire station should look like in our community. Our fire department issues, I've beat you all up with this over and over again. The mold and mildew issues that I've had to stand in front of multiple news cameras discussing. That bottom left picture right there, that's where our oxygen is housed that goes on our trucks that we are no longer housing there, but these are some of the issues that we've dealt with, and this is just unacceptable. To the right is mold and mildew seeping through the administrative offices. These are our bathrooms. One of the 2 stalls is functional. Our firefighters come back, they got 1 shower to use. We launder our contaminated PPE in our locker rooms, as you've seen in some of the other slides. Our bunker gear is exposed to diesel exhaust and emissions, which is unacceptable. Our kitchen is also our living room. So during the day, it's your kitchen. They move the table out of the way and it becomes their day room at night so they can relax, decompress a bit. This here are some of the issues with our stations. I don't really need to beat you all over the head with this anymore. Our stations are old, they're antiquated. I apologize to my firefighters, especially my female firefighters when I come to work every day, to not be able to provide them with the facilities that they need, and our firefighters for not being able to protect them from the effects of the carcinogens that they're exposed to. Not to mention COVID-19 has taught us so much on what a new station needs to look like. I ask that council take a really good hard look at what some of our funding options are, none of the information in these slides is disputable. These are facts. What's to be disputed now is what level of service you want to provide to your community. I can run this fire station with one ambulance, this whole city, but it's a level of service that our residents have come to expect and deserve is what we're going to be talking about moving over. And Mr. Evans, that concludes my presentation to council. Thank you for your time.
Thank you, Chief. Mr. Evans.
Well, I know it's 10 minutes till 10, and so we wanted to open it up if there's any questions or comments from the board concerning Chief Kurt's presentation or any additional items you would like for us to look at as it relates to fire services and, you know, the discussion that we had with regards to the fire assessment and what that resource could be utilized for.
I think Mr. Lawson.
Thank you, Madam Chair. Chief Kurt, thank you for the presentation. With us being considered a high-risk occupancy or high-risk community, what efforts are we putting in place to ensure these high-risk targets are protected against significant structural fires?
Well, one of the positions that, unfortunately, due to budget constraints that is not being funded is a community risk reduction. If you all remember in December, we talked about community risk reduction. This is being able to get out into the community, make a more robust fire prevention division to get out to some of these facilities. Currently, we have 2 inspectors right now for the whole city, and we have no community risk reduction officers. We are making every attempt that we can. We've met with members on Singer Island to talk about hurricane. We've met with different community groups to discuss COVID, but unfortunately, we haven't had the success that I would like to see moving forward.
Okay, and then just a follow-up to that, increasing personnel, is that going to reduce our call volume or service times?
It won't reduce our call volume. Community risk reduction is the attempt to reduce call volume. Being able to get out into the community, being able to educate people on hypertension, being able to make sure that when individuals are released from the hospital, that they have the ability to go pick up their medication, transportation to get their medication. These are some of the important things that we're going to be talking about. And it won't necessarily reduce our response time. What it'll do is get the appropriate number of resources on scene in the appropriate amount of time. I hate to say this, Mr. Lawson, but it's smoke, Councilman Lawson, it's smoke and mirrors. I can get a fire truck to a scene in 4 minutes, but I got 2 dudes in a truck stepping off that truck. That is not adequate firefighting. That is me simply looking to hit a stopwatch so I can appease the community and say, we have a 6-minute response time, one of the best in the county. But I got 1 truck with 2 people stepping off of there with a person in cardiac arrest, starting an IV, CPR, intubation, medication administration, loading them on the stretcher. All of these things take resources. And that's what bothers me the most. And I want to make sure that it's very clear on how much it bothers me and how passionate I am about this.
So, and that was actually to the point of us taking a look at our staffing and the operations, because that's something that you've been consistent on since I've been in office, that we do not have adequate staffing. And the issue we're running into is we need to find the reasons and the resources, but essentially we just need to provide the right support for our firefighters and our first responders that are being put into these positions that are essentially, as you say, life or death. So right now, for them to be undermanned is just not acceptable, but we have to find the funding. And I am in support of the fire assessment, and I want us to move forward with it as long as it can provide that support for our department, but it's finding out how we can effectively roll it out as aggressively as possible. COVID has kind of delayed the ability to get it out to the residents. And that's been our issue, the community involvement and the charrettes and the engagement of letting them know, listen, this is essential to operating effectively and efficiently. But I just need us to find a solution to fund it, because as you've stated since day one, that we have to provide adequate support for all of our firefighters. And I'm not really worried about the reduction or the increase or the decrease of the call times. I'm just worried about keeping our firefighters and our community safe. So if we can get that down and shave it down 10 seconds, 5 seconds, that's great. That's wonderful. I don't care. I want to make sure that our residents are safe. I want to make sure that our firefighters are safe. So how do we fund it is the concern. That's going to be left on Mr. Evans and Mr. Sherman. But I just don't want to drop, $100, $200, $300 fee on lowest median income residents in Palm Beach County. So that's just my concern of how to fund it and finding additional streams. And I really want us to be aggressive with finding some additional streams to fund it and getting you the support you need. So I'm completely in support of the assessment, but it's just how do we roll it out quickly and aggressively and responsibly.
Thank you,
Chief.
Councilwoman.
Excellent. Thank you, Chief.
Miller Anderson. Sorry, that you're done. I'm sorry. Miller Anderson.
Thank you. I know I could hear the passion in Chief Kurt's voice, and that's because he's been talking about this, either him or Chief Durham has been talking about this pretty much since I've been here. And the fire assessment has come up a couple of times over the years, and that has been a can that's been kicked for a while now. And, I certainly support the addition of those, the firefighters to be added to this position, to this area, because we don't want to burn them out. I mean, obviously they're doing what they can do because they want to get the job done, but you don't want to put people in positions of, either getting hurt or hurting someone else, or, being negligent because of, maybe they're tired for whatever reason. So I think, no one ever wants to add taxes, especially when they have a possible election coming up. So that, is never something good you want to say during that time. But, if we're unable to find the monies in other areas, we have a lot of choices that we need to make. And they're very tough choices that we have to make and decisions that we have to make. And I don't, at this point, I don't believe that fire should be one of them that we're trying to pinch the pennies on. I certainly am not in support of just putting everything on our residents, just like I'm not in support of putting everything on our employees with the insurance issue. But we definitely need to see how we can educate the community on what their fire assessment is about, how that can work without putting a serious burden on our residents. But if that is the only way we can get it done, I would be in support of it. Obviously, trying to minimize the impact that the residents will feel from it. But I definitely believe it's time for us to go ahead and make the additions to this department, because this has been going on for a very long time. And unfortunately, no one or no council group has ever wanted to take on that to be the one to make it happen. So, unfortunately, it's going to be a tough decision. And if we can find ways to minimize the impact, I think that would be the best thing to do. But we definitely need to do something to make it happen. Thank you.
Thank you. Anything else? Okay, well, thank you, Chief Kurt. If Mr. Evans, it looks like it's almost 10 o'clock. Are we going to call it a night and postpone the rest of this, or?
I don't think Chief Osgood can do it in 2 minutes. So.
Okay. Councilwoman Anderson, Miller Anderson.
I mean, I'm okay. I know we put the times in, but I'm okay with hearing police, and that would be it for the night, right? Just police you're trying to get through? Because that's going to add on to the others, right? That'll add on to the other nights.
That is correct.
Well, how much time does Chief Osgood need?
I don't think we should rush. I don't think we should put a time on people.
I just want to know how much. Well, if he needs an hour and a half, then I have a different opinion about it. If he needs half an hour or 45 minutes, it makes a difference. I mean, an hour and a half, how much, just a simple question. How much does he, okay. I'll ask you another hour.
Prepare for an hour.
I mean,
At the
remember,
same-
we're trying to cut back some days here. I mean, remember
Right.
that. I mean, we're already having trouble trying to fit in extra time. So we need to make it happen while we're available.
Right, Councilwoman Lanier.
No, I certainly understand that. But I want this presentation to be able to go on as long as it need to. And we're talking about the fire department. I mean, the police department, which means that this could be an hour or two, based on the fact that there are a lot of issues that we need to address when it comes to fire. I mean, I'm sorry, I keep saying fire. When it comes to police. So if you're willing to go 2 more hours, then that is probably where we're going to be.
It's your, I don't,
Okay.
what's
I make
one
a
of the-
motion. I mean, well, I can't make
Yeah,
a motion, it's workshops.
It's a workshop. Let's get started. I mean, if it gets to be midnight, then it's, you know, then we might say, hey.
but can we at least take a 5-minute break before we get started? So
Yeah,
we can-
and I might have to start passing the gavel a little bit once in a while, Mr. Lawson, in case I need to take a break, because I haven't been off this camera yet. So, yeah, let's.
I need to
let-
take about a
let-
5-minute break.
Mr. McCoy?
I'm sorry. So, Mr. Evans, how long are we talking about here?
Chief Osgood's presentation's probably about an hour.
Well, members, I don't know if you ever had a conversation with Chief Osgood, but I think I was on the phone with him.
That's why I said 2 hours. It's gonna be 2 hours. I'm telling y'all, it's gonna be 2 hours.
Well, let me
Yeah,
just
I
say
know
this. At least you, look, guys, I think Chair Botel, Chair Pro Tem Lawson and myself were actually at the workshop. So, you know, we're kind of getting a replay. So I don't think the two of you probably, you're going to get the firsthand experience in person as much as possible. We had this at the workshop, the same presentation. So we're good sports. The one you two didn't, the two you all weren't able to come to, that the three of us.
Hey, I'm sorry. Did you not see COVID-19 numbers go up? And I got
I'm just saying.
Okay, all right. We're gonna, unless Mr. Evans would like to.
I really would like to hear Chief Osgood. And I would like to give him the 2 hours that he's going to take. But midnight, I'm telling you people, I can't. I'm not gonna be able to do midnight. This is it's late. It's after 10 now.
Chief Osgood has told me he can do it in 45 minutes.
I'm talking to Osgood.
I try to say
The
that
sooner we get started, the sooner it'll be done. So let's take it away, Chief Osgood.
All right, so I'm taking 5 minutes, so y'all can go ahead.
Okay.
That'll need to go too, because I would have much rather that even if we would have switched the order. Mr. Evans, do you have these folks that's on the agenda on standby? The clerk
we have the administration and finance can be able to present, but those are those are probably 10-15 minutes.
Well, you want to knock those off and call it a day?
Whatever the pleasure of the board is.
I would like that better. I would like to get those other two because I want some time with the police.
Yeah, I don't want to.
And I mean, we've been sitting here for 3.5 hours, and I would like to be fresh, and I want to be able to have some time to ask my questions, to be able to think, talk about some innovative things. I think that we can get the admin and the other one out of the way, and we can start at the top of the hour tomorrow at our next meeting with the police, because I really want to give this the time that it deserves.
So, Mr. Evans, would this be the last two on the bulleted list, the legislative department's budget presentation and the city administration department, those two? And that way everybody else could go home? I mean staff.
We can do legislative and city admin and finance. Those are small ones.
Okay. I think, do we have consensus? Let's do a thumbs up if we think that's okay. I see 2, 3. No, Kashama wants to hear the police. Well, I think it's 3-2 without voting. Well, I know we're not voting, but it looks to me like we're the feeling of the majority is that we see 3 shorter ones and save our strength and energy for police on another night.
Okay.
Yep.
Mr. Evans.
All right, we'll go into.
Thank you, Chief. Thank you, Chief. Where'd he go? He's gone. Thank you, Chief.
All right, so we're going to go into the legislative department, which is the city council. We did.
Sorry, Mr. Evans.
Yes, sir.
That's not the city council. I prefer if you say that's the smallest budget of the entire city. Because people seem to tell me in the community, you guys make $100,000 a year. I said, this is Trodrick McCoy, not Randy Sher.
We in the legislative budget, actually looking at the numbers, it's not the smallest. Actually, procurement and the clerk's office actually has it beat. But the quality that we get from this department is hands down the best.
Well, and please start out, Mr. Sherman, with why these budgets are so different and why I have the smallest amount in my budget. So let's start with that first.
Okay, so I'll go ahead and start it, and then we'll Mr. Sherman can speak on the numbers. Legislative. The legislative branch of the agency is the city council and mayor. Under the city council is city administration, the city attorney.
Miss Miller, Councilwoman Miller Anderson has a hand up.
I don't see anything. Are you showing a slide?
Oh, am I not?
There's a blank page.
Should be. Hold on one second. Share screen, application. Let's see.
There you go.
All
Thank
right.
you.
Yes, here we go. So legislation, our legislative branch is the city council, mayor, and under that is city administration and the legal department, the two individuals that within the structure of the city that report directly to the city council. This particular budget has 3.5 FTEs, and that represents the legislative aides that are in the particular budget. You can see that the tentative fiscal year 2021 budget is an increase of 3.72%, and that usually is predicated on the increase of whether it's insurance or other ancillary costs that the city would increase. So it's a modest increase with regards to operations. The budgets are consistently remaining the same. There has not been any deviations or modifications, and we are not reducing any council members. We're keeping all 6 council members as part of the budget process here. So there's no staff reductions in this budget.
Mr. Evans, if one was to go, who would it be? I think I'm on that short list.
Mr. Sherman, if you want to communicate a little bit with regards to the specificities of the legislative budget and to address Councilperson Lanier's question.
Sure. Good evening, everyone. Randy Sherman. As I mentioned last night, we're using the Tyler budget module to load salaries and benefits. And the system is very sophisticated. And of course, this is the first year we've been using it. But what the reason you see a little bit of variance between the budgets is it depends on whether you had a vacancy or not. It depends on what position the individual is in. So for example, in District 4, The individual, when we loaded this information, was not listed as a legislative assistant, was listed as a youth worker. So of course that has a different calculation. The only real factor you'll see once we go back in and make some of these modifications is really in the health insurance line. And that's dependent on which individual health insurance each council person has, because the city pays 100%. There could be variations in the amount of money that you'll see in the health budgets. But overall, as city manager said, the line items are not changing. The position counts aren't changing. And the budgets will be fully loaded. So at the end of the day, you're going to see budgets in the $120,000 range per council member.
Councilwoman Miller Anderson.
I had a question about how did the Citizen Leadership Academy get back in my budget? In this, well, not my budget, District 2's budget.
Right. And if she has that, then I want something too.
No, ma'am.
She doesn't want it.
It's
want it, but
it wasn't in my budget last time because it was supposed to be a city function. So has it not? Is it no longer a city function?
No, it will be modified and placed under the city manager's office. That's one of the things we'll go back in and correct.
Okay, I just was wondering if it was being put back on my plate again. Thank you.
No. Yeah, your budget is the only one that actually has that line item, and we didn't want to lose track of it, so we'll move it over to the city manager's budget.
Okay.
Where are the car allowances? Do they get put under regular salaries and wages?
Yes, ma'am.
Have we taken a look, and I've asked this before, I know, at examining other cities, other comparable cities, and what kind of car allowances they afford their legislators? I think that was something I asked many months ago.
Yeah, I'm sorry.
I think it's important for us to take a look at what other cities, other comparable cities provide in terms of transportation to their legislators. Councilwoman Miller Anderson.
Well, as you all know, for the past 2 or 3 budget sessions, I have cut my travel and promotional. So that is certainly something that everyone could take a look at their own budget if they want to cut back on their budget. I've cut my travel in half and my promotion was cut in half. This is probably the 3rd year, maybe, I think. And so that is certainly an opportunity. I mean, you can cut any of these items down other than, the taxes, the salaries, the retirement and health insurance. And, well, you can do like health insurance if you don't take it. So there are other items there that you all can certainly maneuver with if you want to. So I'm fine with keeping mine the same way this time as well.
Madam Chair.
Miss Lanier,
Yes,
I wanted to point out, I didn't see you say anything about me having less than you in those areas. You talked about the others being more than yours.
Chair.
Councilman McCoy.
Okay, I want to respond to the gentlewoman from the 2nd district. I think I want to go ahead and give her kudos for cutting her budget. But if you look at my budget, I just don't spend the money. So while I think it's good on your part, on the front end to do it, I just don't think it's important for me to turn around and cut off something that we may need. If there's an emergency that we may need to go up and lobby our legislatures, guess who won't be traveling? Probably the gentlewoman from the 2nd district. And I think that's great, but it almost kind of puts us in the light that we're not being fiscally responsible. But I can tell you, I actually looked at Tyler Munis and seen some stuff I almost called finance. And I realized it actually existed from the prior councilwoman from District 1 before I got here, because I make it a point that it's not a priority for me to do a whole lot of travel and do a whole lot of these other promotional events, because I want to be conscious about taxpayer dollars. So I certainly commend what you're doing, but it doesn't necessarily reflect that because you're taking cuts on the front end that in some way the other members of the city council are making these expenditures, because I don't. There's more money that's returned back to the general fund from our district just as much as it is for yours, Madam from the second district.
Councilwoman Miller Anderson, do you want to reply?
Yeah, of course. And of course, by no means is it to say who's done what, but my point was we have options. So that is an option that I took. That is not something that everyone has to do, but you have an option, just like Dr. Botel mentioned about changing the car allowance. So my point in saying that was that everyone has an option to manipulate their own budget if they want to. And a lot of it I don't necessarily use either, even when I cut it. And if please keep in mind, you know, the CRA side, the commissioners on the CRA side has travel money and other monies as well. So there's some on both sides. So no, I appreciate your comment. However, you know, it's just to say that you do have options. So if you choose not to do that, that's certainly up to you.
Madam Chair, can I ask Mrs. Sherman to go ahead and distribute that extra money to the 5 other elected, since she doesn't want to use it? Let's go ahead and do that now before we get started.
I just want to get back to my original question, which was, do we have any sense of what other municipalities do with regard to travel? And I don't mean travel, I mean the car allowance. Mr. Evans, have we ever done an analysis? Have we ever done an analysis of that?
I would have to defer to finance. I don't think we have, but that's probably something that we can obtain, Mr. Sherman.
Yeah, two years ago, under City Manager Hoskins, they actually did an analysis. I'll have to go back and try to locate that study, and obviously it would need to be refreshed, but it's been a couple of years since we've looked at it.
I think we should at least look at that. Yes, Councilwoman Lanier.
Councilwoman Miller Anderson said that we have some on the CRA side. We got money at the CRA for?
Yes, for travel, yes. It's larger, actually, I think, than the allocation from the city. I think it's in the neighborhood of 10 rather than, I don't know, 7.5. Yeah, we do.
I didn't even know that.
But don't worry about it, Councilwoman Lanier. I didn't use it either, so you know I don't need to boast about it. But me and you,
I didn't even know it existed.
I haven't used mine either, but it's there.
But in the event, can I just throw this in there, Madam Chair? I certainly respect and understand what you're saying, but I literally was brainstorming today with someone. I've not found a municipality that share the same responsibilities and duties that the city of Riviera Beach. And I think I was speaking to someone on staff at the city of Riviera Beach, and the closest that they came up with was the city of West Palm Beach, that also doubles in the role as the CRA, but also the utility. Yeah. I beg your pardon?
No, I was like, yeah, you're right.
In the county, who also sits as county administrators and the solid waste authority. So, I mean, it really sounds good on the surface, but members, I tell you, we are very much demanding in our elected roles, which encompasses 3 hats. So, you know, if you guys want to have some desire to take our budget further down than the very minor, what is it, 2% of the grand budget of the city, not even 2% of the entire city's budget, then I'm okay with it, but just know that we're asked a lot and expected for a lot.
I appreciate that. I think I'd just like to have the data about that so we can consider it at least. So all I'm asking for is an analysis of comparable municipalities, if we could take a look at that.
And my point, Madam Chair, is there's no comparable municipality.
Well, maybe they can find one. Okay, moving right along, Mr. Sherman. Who's doing this now? Mr. Evans or Finance? Great.
For Mr. Sherman to get into his department.
Yes, and okay, so next slide. Or to turn it over to me.
I can turn it over to you.
3 slides, so okay. Yeah, Finance Department is broken down into 3 areas. We have our customer service group, which really does the utility billing and dealing with the meters and the customer calls. We have the Treasury Services Division, which deals with all of the cash issues, debt issues, BTR. And then what we consider our Financial Services Division, which is payroll, accounts payable, grants, and then any financial reporting that is required by the city. Our 2021 budget, we are making some significant, I'm sorry. Is this me? I can go? No. Next
You
slide.
should be able to. All right, let me.
No. Too late in the day for that.
All right, there we go.
Okay. Right now, the finance department has 30 positions. We're actually looking to reduce that to 24 positions for next year. We are moving a couple of people around into some vacant positions and then eliminating their positions. The first thing that we're looking to do, though, is actually reclassify 3 positions. When I first joined the city, we had one manager who oversaw both the customer service group and the treasury group. And at that point, I created a second manager position. Now that we have moved forward, we have the new AMI meters, we have Tyler in place. Those positions really need to be redefined. So we're going to come in and redefine the treasury manager position and the customer service manager position, and then the assistant customer service manager position. And again, come back with new job descriptions and in classifications as determined through the human resource. After that, though, there are 6 positions that we will be unfunding in the department. The billing and collection technician position, again, with the new meters and the new billing system, that's a position that is vacant and will no longer require. We have 1 business tax receipt specialist position that is vacant. We'll be eliminating that position. 2 customer service rep positions that are vacant, and we'll be eliminating that. And then we have 2 individuals that we are looking to transfer to assist in other departments. Currently, I have 6 people 6 gentlemen in the field crew. Again, with the new meters, they will not be out in the field meter reading anymore. They'll really be just responding to notifications that the system is telling us about irregularities in the system. We took on an individual who was transferred out of Public Works at one point, and it's that position again that we're looking to transfer over to the Parks Department. I also have an accounting specialist.
Can you speak to what position that is? Because that seems like a whole lot of moving. Are you at liberty to tell us that position to go from Public Works to the utility billing now over to Parks and Rec?
I prefer to keep the name offline. If you want to talk about it, we can. I'm not sure we want to talk names in the budget session. I can if everybody wants to know, but I think we're
no, thank you. Oh, there's Miss Wynn. She said no, but no, that seems like a whole lot of movement.
Well, again, it was a position that was I had 6 positions. 1 was vacant due to a retirement. We were trying to live with the 5, but we had the 6 vacancies. So we had an opening to move this individual into. And again, after the evaluation, 5 is certainly sufficient. So we're again looking to move that person back to another vacant position, and then we would eliminate. And then again,
and I think it's important to note that their salary will be held harmless. So we're keeping them gainfully employed. We're just moving them in another department, and you'll see that was a lot of the movement that we did, is that we did want to keep people employed if at all possible. And so we move them to different departments and different operations if they had the skill set to be able to work within that particular operation, and the city would benefit as a result of the transfer.
Yes. I also,
Can I ask a question
sorry.
before you go too far?
Yeah,
The
go ahead.
billing and collection technician, is that the field person that goes out?
No, that is the individual that's a desk job. Under the old utility billing system, it was quite a lot of manual intervention to come up with those bills every month. Now with the two new systems that we have, that is no longer necessary. So that individual is actually will be the assistant customer service manager. So when I lost the customer service manager, the assistant moved up, the billing tech moved up, leaving the billing tech position vacant.
My apologies, I was actually wrong. The business tax receipt specialist, that's in the building, that's not somebody that works in the field, is it?
Correct, in the building.
Do we have any field workers, or do they double in that capacity to go out and do field work?
We do have one person that goes out occasionally if we get a complaint or a question, but it's not very often that individual goes out.
Well, and this is a whole nother conversation, Mr. Evans, but I would like to see, because we're finding out businesses that we didn't even know were businesses, or even, I guess, classifications we didn't know exist. Perhaps that's somebody that can be, I guess, is more probably appropriate to be done from code compliance. But certainly, I want to make sure that we have somebody that's keeping track of who's in business in that respect. So, okay, I just wanted to make sure.
Okay. And then my sixth position is I actually have two accounting specialist positions, and we're looking to transfer one of those individuals over to the procurement department to assist with the entire P card and any analysis that Ms. Pemsel may require. So again, rather than purge the position from the city, we're trying to find locations and have had those conversations about moving one individual into the procurement department with some good accounting experience and certainly good knowledge of the Tyler system. Moving to the upper right-hand box with the operating budget, as you can see, the actual budget that has been proffered for the department is going from $3.1 million to about $3.05 million. So it's about an $80,000 reduction in the operating budget. As you can see, most of that is in the personnel line. So despite the projected increases, the 6 positions that are being unfunded has caused our salaries to actually drop 5%. There is a slight increase in the operating. That is primarily our IT budget. There really is no increase in any of our other line items. And then capital, in 2020, we had money in there for a copier, which we are not funding, obviously, again in 2021. Our goals continue to be, as they have been for the past couple of years. We're trying to generate more reports, have more transparency. I know you probably have seen like our debt report and our quarterly treasurer's report, and we want to do more of that as we move forward. We would like to get the GFOA certificate for the CAFR, but that's a long process. Number of years we did submit the CAFR last year, and they gave us comments. They didn't pass us, but they did provide us comments that we will incorporate into future CAFRs. The biggest issue down in our section with goals is really the continued implementation of Tyler. Tyler is it's very powerful. It's very in-depth, and to be honest with you, we have really just scratched the surface of what the system can do. We're learning new things every day. It's giving us good information in timely fashion. But as we know, you have to have the data in the system to be able to get the data out. So earlier, like when you were looking at health insurance, I was able to run the numbers. You know, we have 34 CRA employees who are on our health insurance and 100 pensioners. And I could get that information, you know, that quickly as we were talking. So we'll continue to build that system out. Shortly, you should see for the P card program that will be in Tyler and no longer in BMO. It's not that we're changing providers, it's just that the information will feed over from BMO into Tyler. So the users will only have one system. We'll also be shortly opening up the employee expense accounts in Tyler. That is not a personal expense account, but that is for things like travel and tuition reimbursement. So again, rather than using Q Alert for your travel requests, you'll be actually doing those in Tyler. So those are the types of things, you know, we'll be pushing out in 2021. And at that point, I think what we're going to need to do, because a lot of our policies are 7 or 8 years old at this point, and they're all geared towards our old systems. One of the things that we're going to be focusing on is redrafting, you know, rewriting all of our policies so that they match up with the current program. As far as capital projects, Finance Department does not have any capital projects. I will be back at one of your subsequent meetings to talk about the marina. I'm trying to arrange for John Sprague to come back in and talk about the phase 3 of the marina project, but that'll be at a separate meeting. And if there are any questions, I certainly can answer them, but that concludes the finance budget.
Any questions? Okay, thank you, Mr. Sherman. And anything else, Mr. Evans, for this evening? Did you want to do city administration department? Well, you did legislative. Do you want to do your, or would you rather wait? It's 10:31. It's up to you, Mr. Evans.
We can, if it's the pleasure of the board, we can go through it, or, you know.
I'm okay with getting it out of the way. I mean, how do others feel? Do you want to get it out of the way?
I'm okay with Mr. Evans's department.
Yeah,
Okay.
me too. Ms. Miller Anderson, are you okay with hearing this tonight?
I'm here for the long haul.
Okay, Ms. Lanier, same with you? Good. All right, let's go for it.
You didn't ask me.
You're not, your picture's not, oh, there you are. You weren't, I didn't see you on the screen.
I've been here.
Figured you took a break. Are you, well, if you didn't want to, yes. How are you with it, Mr.
Well,
McCoy?
I want to
Are
find
you
out.
okay?
I guess I want to get clarification, because general administration and city administration are two different things, correct?
Yes, we're doing city administration.
And this is purely your department and under your supervision.
That is correct.
Okay, all right, good enough.
All right, so we're getting into city administration. So under city administration, you have economic development, internal audit, the departments, and the grant function for the city of Riviera Beach. Getting into the proposed budget, the budget modifications are to unfund a vacant media specialist position and a vacant receptionist position that will take the complement down to from 22 to 20. The other side is to create an economic development division under city administration that will be responsible for the items that are enumerated there. Those functions will primarily rest in the city manager's duties and responsibilities, as well as the deputy manager's duties and responsibilities, as some of the projects that we have going forward, whether it's looking for the P3 or the capital project administration, a lot of those projects are going to have to be in close collaboration with city administration. So that particular function is going to be a tag team approach from those that reside within the administrative department. Looking at the goals, obviously, to facilitate the budget process, for us to be more transparent in the budgetary process, we do want to create a transparency portal that allows for residents to get real-time information related to the city's budgeting, its expenditures, and being able to see how we compare to other government entities. We do want to move forward with reinstating a active fraud, waste, and abuse line that will be provided by a third-party entity, and then that information will be funneled to the internal auditor, who would then make the determination with administration what inquiries or investigations that should ensue as a result of that information. Also working in close collaborations with the Office of the Inspector General to address any inquiries or audits that may be ongoing or outstanding. We are still moving forward to hiring competent and capable individuals with regards to the managerial team, as well as the support staff. We are looking at building matrices for pay for performance, as well as making sure that annual performance evaluations are done in a timely and consistent manner, and that there is an expectation that eventually the wage system will be tied to those situations as it relates to performance. The other side is to look to develop a workforce housing initiative to assist home buyers really trying to transition our community from renters to owner occupied. That's a project that me and the deputy manager are going to be working on and bringing some solutions for the board to consider on how we can make that successful. Then in joining relationships with local lending institutions, CRA, Palm Beach County, to look at addressing some of the challenges that we have in our community, and really making us the community of choice, doing everything that we can to spruce up the aesthetics. I believe Councilperson Lanier talked about the landscaping on the west side of the community needs to be consistent as the landscaping standards that we have throughout the community. So it's really going to be a concerted effort in beautifying our community. Another initiative is to move forward with an aggressive public art in public places, and how do we roll that out to make sure that it becomes a symbolism of our community's value of the arts, and how the arts plays a significant role in creating spaces and improving the quality of life. We do want to move forward with utilizing code compliance measures to drive our nuisance abatement process, and really changing the types of renters that are in our community and holding those absentee landlords accountable. And then developing of a community aesthetic plan is something that was communicated in the community values survey. That's a major initiative for us. As it relates to some other items that are not on this particular 2020 goal, is that city administration will be managing the initiatives to move forward with some of the modular facilities that we talked about, moving forward with the new utility district, rebranding the city's marketing collateral as well as its website. And I'm proud to report that our website, the new website, should be up and operational probably in the next 30 to 45 days. You'll see a new look for the city of Riviera Beach. We are going to work with the community as it relates to what the next phase of these long-term city facilities are. So facility management, looking to build out financial matrix that speaks to how we are going to pay for these facilities, and how we're going to make long-term investments in our community to continue to promote diversity and inclusion. And I think one of the things that we're going to make sure is that we proceed forward with getting a disparity study to address some of the concerns that have been articulated by the board. With respect to the operating budget, you can see the specific departments and the modifications that were attributable to moving some of the operating expenses into other accounts where they should probably be better reflected. But in totality, the change was about 4.3% to the city manager's budget.
Questions? I can't see. Mr. Evans, could you, if that's the last slide, could you get rid of it?
Yes.
McCoy has his hand up. McCoy.
Thank you.
McCoy.
Thank you, Mr. McCoy.
Thank you, Mr. Evans. So
Yes,
the
sir.
budget modifications, it went off, accounted for Economic Development Division, but it didn't specify. It seemed to suggest some initiatives. Are there additional positions that's going to be associated with that?
No, sir. There's no additional positions. No, sir.
So what's the impact of creating that department? Because I guess I wasn't very clear from the slide.
There's no fiscal impact by creating that particular division. But what would happen is, as we look to move forward with more activity as it relates to economic development, and if any positions are moved around or any vacancies are found and we can then create that division, we would do it with existing staff complement to backfill that particular division. So it's not something that conceivably would add for additional personnel or what have you. We would deal with it with the existing staffing complement.
Okay, I don't have that. I guess I don't have that spreadsheet, but I particularly am concerned, and let me be clear. I don't want any of your positions other than the city manager dealing with the CRA, not one person. And I think it's very important because the division and the separation of the two different entities get confused, and it creates potential problems. So I don't have it up on my screen because I think you're no longer sharing it, but I promise you, I will go at very great lengths to make it available publicly and to the members of this body why I don't agree with it. And it creates a problem. And until we can sweep around our own porch, nobody from economic development other than the manager needs to be concerned what goes on at the CRA. And if this is something that obviously we don't understand, I would love to bring it to a voting meeting and I can lay all the facts out. So, Ms. Evans, we meet again next week. I would love to have that on the agenda, but I don't want anybody from the city of Riviera Beach other than administration, meaning the manager or the deputy or the assistant, to deal with the CRA. And that's all I have on that. And I would love to bring it to a meeting and lay out the facts and present it as an agenda item, but that is not something that I support. And I see that I seem to be getting some resistance from some members. I guess I'll just go ahead and add it to the
Well, I just don't really understand how you can
That's
function.
why it'd be best explained at an agenda meeting.
Mr. Lawson. Your microphone, Mr. Lawson.
Sorry about that. Thank you, Madam Chair. Mr. Evans, I know we had some brief discussions in regards to possibly looking at a management analyst position. kind of a level or training position. What department would that fall under if that was something that was looking to be created?
If we would look to create that management analyst position, that would be a position that would reside in administration. Usually those particular positions are positions that are groomed to work in work with multiple departments, and then look to eventually move into the management structure as they look to eventually become department directors, assistant city managers, and managers in the long term. So that would be something that in most cases would reside in the manager's office, but they would be assigned, in most cases what they do is they get assigned to different departments to be able to get a good breadth of experience as it relates to municipal management.
Okay, so that's something I wanted to actually bring to the colleagues tonight. I know that we're trying to trim the fat and really work aggressively on our budgets, but one of the discussions and one of the programs that I've seen throughout the nation that's working is training from within, and looking to actually hire and train our staff, bringing them in from a management analyst position, training them through the ranks, and working with different department heads and working within the city manager's office. Not necessarily an internship program, but essentially a analyst position to get them certified and trained in different levels of management so that we can kind of keep our talent here in the community. One of the biggest things is that we have a limited staffing when it comes to management positions, and we're hiring people from all over the nation, yet we have a lot of homegrown talent that's qualified here in the community. So I was asking Mr. Evans if he could take a look at a few other locations throughout the nation that provide like a management analyst position where they can go through the levels 1, 2, 3, senior analysts, and then up to assistant city manager, deputy city manager, and city managers, so that we can kind of really groom individuals here in the community. So Mr. Evans, I know you're kind of familiar with that, but if you could kind of give the colleagues just a brief overview of that, and then see if there's an appetite for entertaining that position within your office.
Yeah. So when I was the assistant to the city manager in the city of Largo, we created a management analyst team, and the management analysts all had to have graduate degrees, and they come in with very little experience. And so the analyst would report to the assistant to the city manager, but they would handle a lot of special project administration. They would do a lot of the prep work for city administration. They would be assigned to a particular department to assist with budget preps or capital projects or project administration. And basically what it was doing was grooming them, and they would move from management analyst 1 to, after a year, they'd be analyst 2 to 3. And then after 3, they would move into the assistant to the city manager role, and then either move into a department director track or to an assistant city manager at a smaller city, or, depending on what they were exposed to. And so I'm familiar with the program. I actually came up through that type of rank, but it gives you an opportunity to really expose yourself to multiple aspects of city administration. And we had in the city of Largo, I think the program is still in existence now. And out of that program, I think there's been about 10 individuals that have gone on to be municipal managers, and probably about 5 that have gone on to be department directors. And that's been since 2006. I was there from 2006 to 2012.
And with that, thank you, Madam Chair. With that kind of experience in the training, especially with Mr. Evans coming up through that program and him currently being our city manager at such a young age, I think that's something that would be a great program for us to initiate here in the city that could be impactful here in the community, with really training from within, getting those individuals certified throughout the ranks, and allowing for us to kind of, hire from within as well, instead of having to look outside of our 8 square miles, finding that actual next city manager after Mr. Evans, retires. That would be great to have them trained right here in the city. So I guess my question to my colleagues would be, would this be something of interest to have Mr. Evans possibly looking into adding into his budget?
I'd like to hear more about it. From my perspective, it sounds like something that could be interesting. It would be great to grow our own talent locally. But let me hear from Councilwoman Miller Anderson.
I think it's sounds like a great program, but I think given the fact that we're sitting here faced with, making these very tough decisions, I don't see right now that being a top priority in my mind, being that we have a number of areas that we really need to focus on trying to trim the fat, so to speak, or at least be able to implement some things that we know we need to do, but we don't know how to do it just yet. So I'm not off the table with it, but I don't, it's not at the forefront for me right now. But I certainly could support it if we can, get the things we definitely have to get done first.
Somebody's got background noise going on. If you can mute. Anyone else want to weigh in on that? Okay. Councilwoman Lydia.
Yeah, the idea sounds decent enough, but we have a assistant to the city manager and an assistant city manager and a deputy city manager that can go up the ranks to that position. I'm on the mindset of Councilwoman Miller Anderson is that we have such large fish to fry that this seems something that could be looked at later on down the line. But for right now, I think we need to scale these larger fish.
Thank you. I wonder if it's something that we could look into partnering with an institution of higher education that might be able to place interns. If an institution of higher education in the vicinity might have a program in public administration, that they could consider having people placed here on an internship basis, so that we're not spending any money for it necessarily, or we're spending minimal amounts of money, and yet we're providing that kind of training.
One of the things, and certainly as we go through the budget process, and if this comes back up, we can look to do a couple of things. I've seen a situation where they provide a stipend and say, or it's a part-time position that's not benefits eligible. I've also seen a situation where, and we did this in Madeira Beach being such a small city, that we partnered up with the local cities and say, you pay 5,000, you pay 5,000, you pay 5,000. And then we shared the analysts for a quarter. So each of the municipalities got together, and that analyst had an opportunity to experience, 4 or 5 different municipalities. And invariably after they were done from that, they were hired full time on with one of those entities, because they got a very good experience associated with that. So there's multiple ways that we can bring back to look at in subsequent budget conversations.
I for one would like to hear more about it and think more about it. Mayor, were you trying to say something? No. Okay, anything else, Mr. Evans?
No, Madam Chair.
Mr. McCoy.
Mr. Evans, is this the time? So obviously this is just your staffing. Will we be taking on the conversation? Well, it's 8 minutes to 11. I don't know how much longer we're gonna last here, but this wouldn't be the time to talk about general administration, right? Or
no, yeah, we're not at that point yet, Councilman.
Okay, thank you.
Anything else? Councilwoman Miller Anderson?
Is this good of the order? I mean, are we about to close out, or we're still talking about the one?
I had a question.
Okay, so I had a question really quick about the legislative budgets. So and the reason I'm asking this is because I know this happened when it typically happens when people are no longer in that position or voted out, and then those expenses or whatever may come through, and it pushes the budget up. And then you have to go get money from somewhere else to be able to put it back at where it needs to be for the people coming in. But my question related to that is, if some of these items in the budget for the actual have already run over, where does that money come from? Because there are some legislative departments that have gone over. Where does that money come from? to, because if they don't have any money that's left over in any other place to transfer, where does that money come from to take care of that if they go over the budget?
The way it looks at, so your total budget for the city council, I think, was $800,000. So what happens is that it is taken from, and Mr. Sherman, correct me if I'm wrong, it's whatever's not expended in the other account goes to supplant the monies that the other particular district budget may have overspent it because it's in one specific account. Or
so essentially there is no budget per district, because if you go over, you're going to wind up utilizing someone else's money who didn't use theirs.
conceivably, yes, yeah, but we would hope that, you know, it's the same thing with department budgets. Yeah.
Right. But I mean, it really gets down to, especially when, you know, we brought up, the comment came up about, you know, some districts are saving money and not using their money and this kind of thing like that. And so it gives the illusion that that is happening. But if others are going over, then you're basically, essentially, instead of having 7,500 for your promotional, you have 10,000 for your promotional. So how do we fix that? How are there no controls in place to avoid people from running over their amount? And I know this was asked during some other previously when that situation happened, but what I was told, I think is that people's, I guess their fees or charges came in after the fact and you didn't know it, and so it kind of got pushed through. So is that still the case, or have we been able to remedy that? And of course you weren't here, Mr. Evans, so I'm talking to Sherman basically.
Mr. Sherman, can you speak to that?
Yeah, we've had a problem in the past with the P card charges coming in after the fact and not hitting the budgets in a timely fashion. Part of that will be resolved when we move away from the BMO and get the payments directly into Tyler. We initially will be doing that on a monthly basis, but then we will work to get that down to like on a weekly basis over time. So those charges, as they hit the card, will hit your budget. So you'll have closer to real-time operations. But as you know, that's been a problem for a long time.
Right. But is that, do you think it's mostly coming from the P cards? I mean, so there are controls in place for other things, purchases.
Yeah, it is. And I want to say it was, I don't know, Councilperson Lanier, you can maybe remind me, 2 or 3 weeks ago, we worked through your budget and found some items that really were CRA charges. Because again, you're using your P card, but possibly CRA. So we go through that process as well and make sure that things get coded properly at the end of the day and charged to the right place. Sometimes we see even the community benefit dollars get put on the P card and don't get charged the community benefit. So that's part of the reconciliation. But the fact that we have that 4 to 5 week lag potentially on those P cards does cause us a little bit of a problem.
Okay,
I noticed in my, but I'm sorry.
No, go ahead if you read something.
I noticed in what I'm looking at here in the budget book that I have travel that I know had to be that CRA conference that I went to with Scott. Right. And so I know that has to be. Likewise, in the promotional, I know there are things that are in here that were clearly workforce development task force things that should have come out of Mr. Evans' budget, not mine. But it all works out in the end, doesn't it, Mr. Evans?
It doesn't. It doesn't. Because clearly, if you mentioned you have a workforce development task force budget, and the gentlewoman from the 2nd district has a citizen leadership academy budget.
No, she doesn't.
No, she doesn't.
She doesn't have that budget.
And I don't have a workforce.
But what I'm saying is, it's being borne by the contingency or the manager's budget. But in any event, it should be streamlined. You know, we have to be examples.
No, no. So,
and
no, wait a minute, hold on. Let's be clear about the Citizen Leadership Academy. So with the Citizen Leadership Academy, when it was initially put on my budget, that was because I took my promotional money or some monies I took from and switched it, and they just made that line item as a Citizen Leadership Academy. There was no additional funds put there. And then from there, the council agreed to make that a city function. So that is no longer a function under my district. Initially it was, but I was using the monies within my district to pay for that. So that is not a separate fund. That's not additional monies. That's not, it is nothing like the workforce development situation. And then, so this got like, that's why I mentioned it being back under my district, because that is not a function of my district anymore. And it was not an additional funding anyway. It was monies that I already had. So no, that is certainly not the same as the workforce development.
Councilwoman Lanier.
No, I just wanted to say that it all should come back before the council anyway, to make a decision. Sorry?
What are you talking about?
No, just the way your academy came back to the council and we agreed that it would go to city administration. That would be for any program that is undertaken by a specific council person, and it becomes out of our hands at that point. It becomes a city function at that point. So that the council to make it a city function and send it to city administration. And for my say so, we can get rid of the P cards. I mean, we're working on operating under the auspices of transparency anyway. So I don't have a problem getting rid of them.
But
Councilman McCoy.
So, Councilwoman Lanier, are you suggesting that if we come up with an idea, we should automatically shift it to the manager's budget? Is that?
No, I'm not saying that. I'm saying that if we all five agree to that, then yes.
Okay. But I know that there was discussion when we talked about the budget the last time, but you know what? I'm not trying to nickel and dime anybody's personal thing, but like, however you guys do it, whatever. But I mean, I wanted to propose an idea, and I have a meeting with the manager about repurposing money, but I don't want it to be something that I'm essentially taking from my community benefits. I want it to be a city initiative, but something that I bring forward. But it is the suggestion that I take it from my District 1 budget and then ask the manager to
No, that's not what happened with me. That is not what happened with me.
Right.
I created that initiative, and then I said, well, I mean, it's the way that it was doing so well and people wanted to be a part of it. That should have been really something that should have been most places. That is just a part of their municipal budget. I mean, I just took it out of my budget because we didn't have it and no one could find any money, and there was no support from the council to make it a city initiative at that time.
Okay, but the question still remains. So I respect what you do and also what Councilwoman Botel does, but it's 4 other of us individuals that's elected. So like, let's figure out a way that how do we, without having to impact the citizens that we have, figure out a way that if we have specific initiatives, how does that get brought to the body as an approval as opposed to impacting our individual budgets? Because, I guess, unless it's brought up in the conversation or presentation, how does the mayor or McCoy or Lawson present something that we want to get the buy-in from the entire city council without first, using it as
the same way that Ms. Miller Anderson did when she did the Citizens Leadership Academy. It came before the council. We all agreed it was a fabulous idea and it should become a program. Same thing with workforce development. It came before the council. Workforce development, the council said we need a workforce development task force. It became it's not my workforce development task force. It's a passion of mine, but it's a city function. It's not a Julie Botel workforce development task force.
It is yours.
So if you've got an idea that you want to have, oh, sorry. Are you hearing me? It's like doing weird things. Are you hearing me?
Yeah.
If you have an idea that you want to do something and you start it because it's a passion of yours, and then you think, you know what, this should be something that the city should be doing as a whole, then you bring it to council and we all say, you know what, this is a thing that should be a whole council initiative, and the city should do this, and it becomes a city initiative. That's exactly what happened with Miller Anderson. I mean, I remember.
Yeah, we all voted on that. Yeah, we voted on that, on putting that in the budget last time.
But let me be clear. Did we have the discussion a part of the budget process?
Yes.
Yes.
Okay.
Yeah, for mine, yes, for mine.
Or did we vote on it as a specific appropriation?
It should have been put in the budget, and I don't have clearly what it is for last time. If you look in the legislative, you see it's not under me. It's not under mine for 2020.
Right, but you offered up that money. But you offered up that money from your.
No, that is not. No. That has nothing to do with none of that. That is not what happened. Mr. Sherman, can you speak to how that happened? Because it has nothing to do with my budget. Doesn't have anything to do with an assistant. Don't have anything to do with me having promotional. None of that. We as a council agreed to put that in the budget last year.
Yeah, if I recall, I believe the initial funding came from your stipend. You decided not to take the
utility district. That's right. That's what it was.
That's how it started.
That's right.
Yeah. And then when the stipend went away, you took money out of your district budget.
Right. And then last year we discussed it during budget, and then we decided to put it into this budget here. Mr. Evans was here. Yeah. So that's initially it was my utility district stipend that I didn't take. And then I utilized the promotional because that money went away. And then this last time I said, well, can we make this a city function, which was no longer mine, and it had nothing to do with my money.
Okay, thank you for that clarity. And Mr. Evans, I no longer need to use Councilwoman Lanier's District 3 sector dollars for the proposal that I was going to talk to you about this week. Yes, we can find the money from somewhere else.
I suggest that you
remember. Excuse me, Mr. McCoy. You do have to get the rest of us to vote on it, though. So
exactly.
You better behave yourself over there.
He's going to want something later on.
Yeah. Is there anything else, Mr. Evans, or is Ms. Nguyen still here for a comment? Go ahead.
Yes, Madam Chair. Ms. Noel, if you're still on the line, she has completed the doodle calendar search and wanted to see if the board was amenable to making the changes to the schedule. Ms. Noel?
All right. So we ran a poll today. I received 4 responses from you. And so we polled for 4 days, some of which was mentioned yesterday. It's August 20th, that's a Thursday, August 28th, that's a Friday, August 29th, a Saturday, and then finally August 31st. Unanimously, the 4 of you selected August 28th from 6 p.m. to 10 p.m. And then just Friday. Yeah, on Friday.
And which day will that take away? The 17th or the 18th?
Yeah, so this is to replace the 17th and the 18th, which is next Monday and Tuesday.
All right, let me go back. Okay.
Right. And then just
replacing both? You said it's replacing both, or just one of them?
Both of them. But again, this is
changing both days?
You want to work with these dates. Yeah. Because the issue is that not everyone can be available on the 17th and 18th. And so by looking at other dates, you can probably replace those 2.
All right, what was the other date besides the 18th, besides the 28th?
The 20th, 29th, and 31st.
But we didn't, I'm sorry, I must have misunderstood. Did you say that we're putting those in our calendars now? Or are you reporting out in the doodle poll?
Yeah, I'm just reporting the doodle poll.
Okay, so you're saying that the 28th will be a meeting?
No, we're saying if the board was not amenable to moving the 17th and 18th, then staff queried the board to see if there was 2 other days that the board would be amenable to meeting in place of those. So you had the 28th, which is a Friday, and then 29th, which is the Saturday, or is there or that Monday, which is the 31st?
Yeah.
Well, we had the 29th in there. We had the 29th in there already.
We had it if necessary.
Okay, so what you're saying now is the 17th and 18th could potentially be replaced by the 28th and 29th.
Right.
I just,
It's a pleasure of the board.
Councilwoman Miller Anderson.
Well, my question on the doodle poll, it had 10 to 6 or some long time, so I said no just because it was that long. So why was it that many hours? That Saturday, the 29th?
Right.
Was
the Saturday the 29th, we would shrink that. That would be probably a 4-hour session like we've done the others.
Like we'll have
That 10 to 6 or the long time was in the event that we, had to do a lot of heavy lifting in that particular meeting, that it would give us yeah.
Because I just said no on that one because I don't know why it was so long, but I mean, I had it written down as a question mark for that one initially, just from the dates you sent out. So I do have that available, but I didn't have 6 hours or 7 hours, whatever that was.
Right.
So I can come on the 29th.
You
And
can.
I said, yeah.
Okay.
Not for 5 hours,
Mayor
6 hours.
Mayor Felder, were you trying to say something?
Yeah, I did not.
Councilwoman
I'm
Lanier.
sorry. Yeah, I did
Go
not
ahead.
participate in the doodle poll because the 17th and the 18th I've already marked for my calendar, and these other dates that were suggested, I couldn't even do any of those dates because I have other obligations. So when this came out the first of the month, and I know that August is budget month, I immediately is on my calendar to be able to make sure I can work around them. So I'm gonna want to do the 17th and the 18th because these other dates don't work for me at all.
Councilwoman Miller Anderson.
I'm sorry, the 29th, I'm available after 12 on the 29th.
Well, it looks like one person can't make the 17th and 18th, and one person can't make the 28th and 29th. Shall we take one of the dates of the 17th and 18th and one of the dates of the 28th and 29th and split the difference so that at least that one person who can't make the 17th and 18th can get one day in, and the one person who can't make the 29th and 28th, can somebody who's got talking in the background?
Doug.
Whoever that, good, Doug. And one person can't make the 28th and 29th. So we'll take one of the days on the 17th, 18th, and one of the days on the 28th and 29th and call it a split. Does that make sense? Mr. McCoy?
Well, I didn't take the doodle poll because I didn't even have a chance to see it yet. I know a few of the members of this body have an extended vacation. They work either for Palm Beach County or for the school district of Palm Beach County, but I didn't have a chance. But I'm actually going to be out of the state on 26th through the 30th. But luckily I have my laptop. But my only concern is you're killing me if we're talking about 2 consecutive days, 4 and 5 hours. I was invited to be a guest speaker at the March on Washington, so I was going to take Congressman John Lewis's place. So I guess I got to cut out of there early because
now last night you had a whole different tune. You said, you got to make it happen. So what happened overnight?
But here's the thing: I don't have a problem with making sure that I'm there, but this is like consecutive days, And
but remember last night I said we were doing 5 already in a row, and nobody heard that. I guess I said 5 days in a row we would be looking at having a meeting.
The budget is the most important thing. I'll make it happen.
Okay, so there we go. All right, thank you.
I just want to point out, it's just realistically, we have a lot that we have to decide on, and I believe that date that I wrote down for that insurance was August. So if we could just take a step back, if I understood correctly, Mr. Evans, we have to let's just put that to the side for a second, that weekend. But we have about 9 days to decide before open enrollment.
That can be pushed back.
Start open enrollment the 24th through the 28th.
They can push that back. Open enrollment can be pushed back.
Okay. And I'll make myself available during that weekend. I just want to make sure that we understand what's going on because, I'm not so much worried about my weekend. I just.
So can we get back to this notion that it's not fair for one of those? Is it Mr. Lawson? Is it you that can't make the 17th and 18th? Okay, so if Mr. Lawson can't make those dates and Ms. Lanier can't make the other two dates, at least if they could each be, if Mr. Lawson if Mr. Lawson is available to come on one of the days of the 28th and 29th, and Ms. Lanier is available to come on one of the days of the 17th and 18th, it means that they will each only miss one of the days.
Right.
So is that a way to go?
Yeah, I can't miss any of these, but I was good with 17 and 18.
I know, but Mr. Lawson wasn't. So I'm just trying to say, if we choose one of the dates, let's say we meet on the 18th, okay, put the 18th in, and we meet on the 28th. That way, Mr. Lawson misses the 18th, and you miss the 28th, but at least you're there for a good number of them.
Madam Chair, I'm great with that amicable solution to make sure that the ship keeps running. Ms. Noel, can you please give us the date that you sent out the schedule for our budget meetings?
Yep, just 1 second.
And if we are to split the 17th and 18th, can we look at having it on the 17th since the 18th is the election?
Sure.
Okay.
Oh God, yes, of course. We people have, yeah, that would be good. Okay.
So the 17th and what?
So this cancel. Hang on. So the 17th, can we start? I have a 5 o'clock personal obligation. Can we start at 6? Could we start at 6:30?
All right.
No.
On the 17th?
No.
Yeah, I mean, I'm working till 5, so it'd have to be after 5.
So we'll start at 6.
Yeah.
We've been starting at 6. So we're going to start a budget meeting at 6 on the 17th. Cancel the one on the 18th and start a budget meeting on Friday, the 28th at 6. Is that good for everybody? And if we're so desperate that we have to have something on the 29th, we'll have to do it, but at least we have those 2 days.
Okay. So from what I understand, we'll keep Monday, October 17th.
Right.
We're removing the 18th and we're going to replace that with Friday, the 28th.
Yes.
All right. And I'll make sure to update the calendar.
Okay.
So since Julie just offered me up, you can.
Well, it's really, it's you or Doug. I mean,
since you offered me up, I can, I would be more amenable to the 29th than the 28th.
How do people feel about that?
I mean, because the 28th I can't do. The 29th I certainly can do.
Okay, so is that okay with everybody, that instead of the 28th, we do the 29th, because then Shirley can be there?
But what time are we talking on the 29th?
But it would have to be afternoon.
Say 1 to 4.
Yeah, that's cool.
Okay, so budget review on the 29th, 1 p.m. to 4 p.m., and we're eliminating the 28th.
Right.
Did I get that right?
Yep.
Okay. Okay. Got it, Marcia?
Yes, ma'am.
Madam Chair?
Yes.
Ms. Noel, if you could give me the date that you sent out the calendar request for these agenda items? I'm sorry, for the budget discussions. When was it sent?
Yep. So we have August 10th, August 11th, August 17th.
No, I think what he's trying to do.
When did you send out?
He wants to know if He wants to know
Well,
if Shirley's.
actually, Madam Chair, I'll
Really?
explain.
All right,
Madam
go
Chair,
ahead. I'm sorry.
I'll
Go ahead.
explain what I want to know.
All right.
Ms. Noel, what day did you send out the dates or the schedule for these budget meetings?
So not the calendar invitations, which was last Friday. I sent out
Okay,
calendar on Friday.
So you sent out calendar invitations on the 7th. So Councilwoman Lanier, you keep stating that we've had this on the calendar for weeks. We got it on Friday, and at the
No. Excuse me. No, she said she sent the reminder. The reminder.
Madam Chair, Councilwoman Lanier, your mic's muted. Go ahead.
Shirley, turn your mic on.
I did not say that it was on the calendar. I said that we had gotten information about these meetings way before.
But we didn't have a schedule, Councilwoman Lanier.
It was sent out. It was sent out in an email that these were the proposed.
It was sent out on Friday. The schedule.
No,
we did
the
not.
calendar was sent out on Friday.
No. The reminder was sent out on Friday.
That's what I just asked Ms. Noel. What date was this schedule sent out to the council?
Right. So this is what I'm thinking. The list of dates, they were in the tentative budget document, and that was sent out earlier than my calendar invitation. That was just to solidify it on the calendar, what I did on Friday. But the tentative budget document
that was released on the 31st, and I think there was a another email that had the tentative schedule. I'd have to look at
that's
in my email.
So being that I've had this trip scheduled for a couple months now, the reason that I'm bringing this up or bringing this awareness to the council is this is very important that we only get one bite of the apple, and I would love for all my colleagues to be at every meeting available. So that's why I don't really want to have to miss any of it. And the compromise I'll make work for that Monday. It's just I didn't get an opportunity to address these dates, nor as a council did we get a ability to discuss the dates we were available. So that was my only concern. I know Mr. Evans is trying to fit all of this into a few weeks period, but my only concern is that I'm always available for meetings, but I wanted to make sure as a council that we were unanimously available to discuss this budget. So that was my only discussion or reason of bringing this back up, because I never saw a date, because I always respond to the doodle reports and to the requests for scheduling. And whenever there's an item brought to the table, I will address my scheduling, because I normally schedule a month or two out. So that's just my only concern with not being available for this Monday, which I actually am very frustrated that I'm going to have to miss, but I'm confident in my colleagues to get the job done. Thank you, Madam Chair.
You're welcome. Mr. McCoy?
Okay, just for purposes, I got it. After year 2020-2021 budget schedule came on July 17th at 11:18 a.m. And I think I missed it too, but in any event, I'll be there. But that's
okay. So we know what we're doing. We're having a meeting on the 17th and on the 29th, right? And Marcia, you've got the times. Okay, right. Mr. Evans.
9 and 29.
Oh, Ms. Miller Anderson.
So looking at what was put in the tentative budget, is the 27th off, or we're still doing the 27th? That was already, that's in there. We had the 17th, 18th, 27th, 29th.
I have the 27th in here. I have it in my calendar.
So we're still doing
are we
the 27th?
still doing it? Looks like it, yes. Yep. Because that was one of the original dates that was sent out.
So 17, that's CRA. 17, 27, and 29?
Yep.
Right.
Okay.
And we'll send out a revised.
Okay.
No.
Yes, yeah.
Okay, anything else, Mr. Evans?
Nope. Anybody want to go to Denny's or?
I want to ask this. I know it may be difficult in the planning stages with yourself, finance, and the other departments, but we know that we had a number of departments that was left off the agenda. Hey, Miss Wynn. But can we kind of know a little bit as to what to expect, because there's one budget department I want to eat up, and I think they're over in that 15th Street location on the second floor. So I want to make sure I get a chance to take a look at legal's budget.
Yes, Councilman, I did send the 112-page budget presentation before we started this evening, so you should have all that information in your email inbox.
I'm sorry, I'm still working with dial-up. I actually contacted finance either today or yesterday to get a printed copy, and we had some website issues. But I'll track it down.
Okay.
Thank you so much.
Anything else? Any comments from legal before we sign off?
Good night.
Okay, this meeting is adjourned. Have a good evening.